This is Executive Council for May. If that's where you plan to be, you're here. I'm calling the meeting to order. Can I get a roll call, please? Lisa. Allie. Animesh. Tony Taylor. Rachel. Danielle.
Present.
Madam Chair, you have a quorum. Thank you so much. Next on the agenda is the Executive Director's report. Emily, please.
All right, good morning, everyone. I'm just going to go through the Executive Director report and fill in any new pieces that have happened between the deadline for the report and today, because there are a couple other things that have happened. Under federal requirements, we did just close the public comment period for our 5-year state plan that closed on Monday. We received 35 responses, which you guys are going to look at a little bit later in the agenda. So that is the part of the process that we need to complete before we actually submit our 5-year state plan to ACL in August. I've been attending ITAC trainings and office hours on state plan development, and they're starting to roll out trainings and office hours for work plan development. So that's kind of the next part of the state plan is we got to tell ACL how we're actually going to do the work in the first year. And I did just hear yesterday on a meeting that we usually have to submit 2 years at a time, but they're now only going to require us to submit 1 year at a time. So I'm excited about that. We'll see when that actually implements, if it's going to be this year or next year. Effective council body, you guys might have recalled that we had an MOU discussion when Vicki was still here to update the MOU with Department of Mental Health because they are the designated state agency. So the MOU really says what DMH is responsible for, what the council is responsible for, and where that line is so that there's no interference that's happening between the two of us. Can you get Catherine on the microphone? And it's still in review. So like when I stepped into executive director, I could not find a signature on the MOU. So I've been working with procurement to get a signature on the MOU, and that started last July, and it is still with procurement. So my understanding is the legal review has been done, the division review with Sheila has been completed, and procurement is finishing their review. That's the 3 layers of review that happens with DMH, and then we come together and sign the MOU. So I do get monthly updates from procurement about it. They know that it's an issue, that it's almost taken a year, so it's in progress. Some of you that have been on the council for a while might remember Kat Cunningham. She was a grantee several years ago for an employment project, business leadership or something like that. I can't remember exactly the name of it, but she actually was part of a federal embezzlement charge, and she was charged not just with the council funds, but other funds as well. So it just wasn't isolated to us. And that has been going through the court process for a couple years. And I did receive an update from the FBI last week or a couple weeks ago that her sentencing will actually happen early September, assuming the court doesn't push it back. Seems like every time she's had a court date, it's got pushed back a couple times. So hopefully September 2nd, we will get some resolution to that case. Fiscal management, the president did release his budget for the next federal fiscal year. It's just kind of like the preliminary budget. It just kind of speaks to his policy priorities and values. So we do look at that to see kind of how disability shakes out in the president's budget. For the DD Act programs, that we look level funded in the president's budget. The protection and advocacy, their DD Act part looks level funded. I'm not sure about, they also have federal funds from other things that are not DD Act related. I'm not sure about those. And the USAID does not have any funding allocated to them in the president's budget. So that means this year, the USAIDs like UMKC, IHD will be advocating to have their funding restored in the federal budget that gets approved. We received a notice of award on April 13th. It is almost all of what we expected to receive for being level funded. It was short about $9,000, and that's not uncommon that they hold back a couple thousand because there's a clause in there that ACL, if they needed to do something like build a new reporting system, they take funds from councils to do that. So they hold back a little bit of cash from everybody's allotment, and if they don't end up using that funding, it gets pushed back to councils a little bit closer to the end of federal fiscal year. So we're about 9,000 short than level funded, but that's still on track with what we expect to get. So to make sure we're operationalizing that appropriately, we have a DC trip that's tentatively planned for November that's going to be paired with a conference that's happening in DC at the same time. And we're going to continue to talk about making plans for that, but we're not actually going to start making any deposits on registration or hotel or anything like that until we get that final notice, which will have the 9,000 in it. The state legislature is the body that gives us spending authority. So that's what the state budget says. MODDC needs to be able to spend this much money in our state fiscal year. And that allows us to take our federal funds and put it down in our account and give it out to grantees or pay salaries, that kind of thing. We are seeing a reduction of $500,000 in our spending authority reduction in the next state fiscal year. That sounds concerning, but it's really not concerning. The reason that we had more in our spending authority than what we were appropriated federally is because during COVID, it was really hard to spend our money. It was really hard to have grantees take on new projects, so we had no cost extensions. And we held on to money longer than the 2 years that we usually do, and we kept receiving new appropriations. So we had, at that time, to increase our spending authority. That's not the situation we're in anymore. So our spending authority will cover level funding that we expect, plus it will still cover about a $500,000 buffer, just in case we take on any more funds besides the DD Act. Grant project status, we're still looking really good on our projects. The only yellow one still is the Partners Graduate Conference, which is undergoing planning. We have flyers that are just going out through state printing to get into people's mailboxes. Registration will open June 1st. So we're trying to be mindful about having access for self-advocates to register at the same cadence as family members. And we know from history that self-advocates, sometimes if it's just communicated through email, are at a disadvantage. So we're trying to get information in mailboxes before we open up registration. Under collaboration, I'm going to talk a little bit about the state agency part of collaboration. We are working on the Section 504 lawsuit with the Attorney General's office. We have a couple different partners also that we're working with, like Starcloth and some of the Centers for Independent Living, Starling, which is the Disability Services Provider Association, and MAC-DDS, which is the Senate Bill 40 Boards Association. So we are actively engaged with the Attorney General's office on this topic. You'll see Friday morning, Singyul's going to present a statement about Missouri's role in the lawsuit for the council to approve and for us to get that out on social media to drive people to advocacy. Christina and I have been talking with MoHealthNet and the Medicaid audit unit, which is called MMAC, about the topic of Medicaid fraud, and I think it's been going really well. MoHealthNet has been very welcoming to the conversation. It seems like they really appreciate a potential collaboration with shareholders like us that represent, lived experience. We're really working through some of the explanation of benefit ideas that came out of the last meeting. I'm consulting with Animesh and Colette on that on the side to help keep moving that forward. We'll see how it shakes out. I think our next meeting is early June. Then I've been having one-on-one conversations with Sheila, who is the division director. She's also engaged in the Medicaid fraud topic from a state agency perspective, and that's through, she's using some national guidance. There's a National Association of Division Directors, and so they're also taking on the topic of Medicaid fraud, and she's using that outlet. One thing that's not in the report that I wanted to provide an update on is I received contact from St. Louis University to provide a letter of support for a funding application that they're submitting to the Robert Wood Johnson Foundation. And this is actually through one of our partners' graduates, Tanya, who works through SLU. So she is the longstanding relation. She's using partners as a longstanding relationship to apply for this funding to bring it into Missouri. It is about equitable workplace promotion for invisible minority groups. The title is Governed Framework for Dismantling Systemic Hurdles and Advancing Neurodivergence in the Workplace. So it's not going to be connected to our DD Act funding. This is really just a letter of support saying that we will provide some resources for the project if the funding is approved. And the resources that they've asked us for is connection to like our partners listserv to help recruit neurodivergent participants to participate in the work. Their proposal is asking for $420,000 to do the project. And it looks like we'll be notified late June. If their letter of interest is accepted, then they have to do a full proposal before it's officially approved. We had started a policy advocacy specialist contract or PAS contract that was working directly with Christina as the director and the policy fellow. That contract has been terminated, and we will regroup on kind of what the next steps for a policy specialist would look like in the council work. We're just getting ready to wrap up the state legislative session, and that's been Christina's first state session with the council. So we will spend a little time to kind of talk about what worked and didn't work this last year and kind of what direction we need to move into before we make any more personnel decisions. In terms of committees and boards, I'm going to talk about one that's not on the report. I'm going to talk about the National Association for Councils with Developmental Disabilities, or NACDD. That's the National Association of Councils, and they are located in Washington, D.C. They have a contract that provides our technical assistance through ITAC, so they're kind of related, right, through NACDD and ITAC. I'm on the board of NACDD as the secretary, and my term as secretary expires the end of September. I have an option to run for a 2-year term as a director at large, which is not an officer position, or there's an opportunity for council members to also apply for the election of the board. So I've been talking to Allie about whether that makes sense for her in this next couple years. So we're still in progress of trying to figure out, is that something she's going to want to apply for? If she applies for it, then I cannot, which is fine. If she doesn't apply for it, then I would probably apply for a director at large position on the board, and that would be my last 2-year term. Any questions for me?
Hey, Emily, this is Animesh. So going back to the discussion about Pat Cunningham's, whatever was going on about the embezzlement case, After the resolution, do we expect to get any recoupment of the money? And if that happens, is the council going to get, or are we just, are those monies gone eventually?
Yeah, I've asked my FBI contact about that, and he wasn't sure. So I haven't gotten a clear answer on Amesh. I can work with ACL, who
Okay.
if we don't get it, it would go back to the federal government, which I imagine would be through ACL. So I can connect with them and see. It looked like the estimated fraud for our part was about 35,000 that would
Yeah.
get returned. So I can ask ECL what the process is on that from past precedents.
Yeah, because I think it might make sense for the money to come back to us. I mean, so that we can use that in another project, because ultimately we lost that, right? So we might be able to use it, but we'll see. Yeah. Thanks.
Are there any other questions? Okay, we're going to move on to the budget update. Danielle.
Okay, so I just want to start off by saying recently I attended the Missouri Accessibility Summit, and I have been doing a deep dive into accessibility and usable documents. So, what you're going to be seeing today is totally different from what I have presented the past 5 years. But I am trying to make it usable and accessible to everybody. After today's meeting, if you guys have any feedback for me, I would greatly appreciate it. You're more than welcome to call me or email me. Again, just trying to make it better for everybody. Okay, so first I'm going to start with our current projects for our May 26th council meeting. Our contract employee for partners, end date is September 30th of 26. The project total is $40,000. They have invoiced us $16,667 with a remaining balance of $23,333. Partners graduates, the total project is $68,000. As Emily stated earlier, that partners graduates is taking place in July, so we're looking to be invoiced around that time. So remaining balance is $68,000. Partners speakers, total project is $44,000, ending in September of 26. They have invoiced $21,801 with a remaining balance of $22,199. We have a road ready project that just started this month. Their end date is May 2nd of 2028. The total project is $50,000. Invoiced zero, remaining balance $50,000. Storytelling end date is September 30th of 26. The total project is $85,000. Invoiced $49,585 with a remaining balance of $35,415. Supporting language access in schools ended April 1st of 26. The project total was $200,000. They have invoiced us $199,544. So there is a small remaining balance of $456. Our approved projects that have not yet started, we have Power of Choice, Medicaid Advocacy, the CIE Fiscal Analyst, and Menopause. Celebration of completed projects for this fiscal year is the STOP project, Disrupting the School to Prison Pipeline, and the Strategic Planning. Okay, so that is the current projects. Does anybody have any questions about those? Then I will share. Give me just a second. So next up is our yearly budget projections. Federal fiscal year 25 total award is $1,357,809. The invoice deadline is September 15th of 27 for those funds. Obligated and to be invoiced still left is $222,177. We have already been invoiced $1,135,632. I do not foresee any issues of spending the $222,000 in time. Federal fiscal year 26 federal funding update. Again, Emily shared this in her executive director's report, but our current award is at $1,348,408, which is $9,030 below our level funding. Our total award being the $1,348,408. Invoice deadline is September 15th of 2028. Obligated to be invoiced is the $1,079,361, and total invoiced $269,047. Any questions? That's the budget update.
Thanks, Danielle. Are there any questions? Okay, I see no questions. So next we are going to talk about the meeting that we had with Sharon Spurlock regarding council meeting engagement, inclusivity, etc. I'd kind of like to start by discussing what people thought of the meeting. You should have received a document that Emily pulled together that AI was kind enough to put all of our notes, all of our discussion into a document. Can we share that? So the first thing you should have seen on that is shared purpose and principles. So hopefully everybody saw this document. It was emailed out. So the first thing I kind of want to do is just sort of revisit the meeting in March and see what people thought about the conversations. And then I'd like to go through this document so that we can come up with sort of the ground rules, I guess we'll call them, that we're going to vote on and present to the full council if we get through all of it. So if people can just raise your hand or let me know what you were thinking about the meeting when Sharon came. I do think all of us were in attendance at the meeting and there was a lot of conversation that happened. So if people can just share what they left thinking.
So
Was
Lisa, I would go first. I mean, just my quick thoughts. The meeting overall was great. I think, I mean, definitely we wanted that brainstorming session. The only thing that I think might give a pause to, and it's a valid thing, but given the circumstances for all of the council members, I mean, that are and future members. I mean, the one where we said, hey, we need everybody to be on the video all the time. I think that might pose some challenges for some people, just because when people are virtual, they might be doing something or they might need some assistance and might need to go off the camera. So that to me, it seems like we need to give some flexibility. If I remember correctly, one of the tasks was, hey, we need to expect everybody to be on the camera all the time, which is a good thing, but I don't think it's a practical approach, because people are going to have a variety of reasons not to be on camera. Just my thought. Maybe we can discuss it further, but I think we need to offer some leeway in that, because this is definitely not a kindergarten class, right?
Okay,
Thanks.
Animesh, thanks for sharing that.
Yep.
Anybody else? Allie?
Wait. 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 I think we signed up to do this job, and it's up only 2 days every other month, and I don't think we're saying that you can't go off camera to go to the bathroom. I think we're saying that most of the time we want you on camera. And I think if you took the commitment to be on the council, that you should be able to be on camera and pay attention and focus the whole time. Thank you.
I got all of that, but the very last thing you said. Just be yeah, go ahead. Emily? Gotcha. Okay. You guys got that, Julie? Does anybody have questions about what Allie said, or do you need clarification? Allie, go ahead.
For hoping everybody was in person at every meeting. So if everybody was in person every week before COVID. I don't think it's that much to ask to be on camera.
Thanks for that added clarification. Anybody else? Do we have Tony? Did Tony get here? Not yet? Okay. Anybody else? Rachel, Saniel, have you got any thoughts? And right now we're just kind of talking about our conversation from the meeting.
This is Sanyel.
Go ahead, Saniel.
Basically, I agree with Animesh opinion. That's all I have to say.
Okay. Sorry, I thought you were going to say something else. Got it.
Thank you.
Okay. That's all right. Rachel, have you got any thoughts?
Lisa, I apologize. I think I missed that meeting because I had some medical stuff going on in March.
Okay.
So I don't really have any feedback. But I will say to what everybody else said, I agree that we should probably be on or have our cameras on when we're talking. But I also know from my personal experience the last couple of months, I have not, just because I've had some personal health issues going on. So like right now I'm laying down so I can rest because of personal stuff. And so I just didn't want to look unprofessional on camera. And so my picture looks more professional than what I actually look like right now. So.
Got it. Yes. Okay. So if there's no other thoughts on the actual meeting, then I'm going to propose that we just sort of jump in and go point by point through what Emily pulled together. She's got it shared on the screen. Hopefully everybody took some time to read through it. I think I'm just kind of read through it. I'm not going to read verbatim to you because hopefully you can read it yourself. But so we kind of, so this document that we're going to try to prepare is going to be sort of the ground rules for meetings going forward. So we can use this as a starting point and then vote on what we've come up with, and then we'll present it to the full council. Okay, so the first thing was just a purpose of why we were coming up with this. We want to make sure that every voice is heard, and that we're very purposeful about making sure that every voice is heard. It says the council values diverse processing speeds, communication styles, and lived experiences. So our structure will invite participation and allow time to think before speaking. You might have noticed already extended waiting time, which I know a lot of people find very painful, but we're going to have to get used to it. We also believe that relationships matter, so we're going to make a space to build trust, both on Zoom as well as when we're in person. That is something that, not that we haven't done a great job of, but just that connection of people, whether it's, here in the meeting room or after the meetings, connecting members of the council with new members. And then accessibility is non-negotiable. Captions and other supports are part of our baseline, not an add-on. I'm going to throw out, as part of that, I hear you all saying about having cameras off. If people need their cameras off for accessibility, that's totally fine. If people need their cameras off because they're doing 10 other things, then maybe we should talk about it, because when you are at the council meetings, the assumption is that you are going to be focused, like Ali said, and participate in the meetings. And it's very hard when we're hybrid. There are times that I leave here and I'm just like, was I the only person there? It's very frustrating. So hopefully some of these things are going to help that. Does anybody have any feedback on just that very first section about why we want to write some kind of document like this to set expectations for people? Okay, so Emily and I were just kind of having a side convo. I think we're going to try to edit this as we go in hopes that we can get through it and be able to vote on it today if time allows. So if nobody has thoughts, I guess we'll move on to the next section, participation norms, which will apply whether people are hybrid or in person. Cameras preferred on with accommodations. Keep cameras on during hybrid meetings to strengthen connection and discussion. If you need an accommodation, notify the chair. And then the rationale behind that was members emphasized professional expectations and the value of seeing one another while also noting legitimate reasons for being off camera. And I think that's why we're calling it a preferred on. And personally, I think if I'm on a Zoom, whether it's for my real job or a council that I'm on or a board, if somebody just were to say at the beginning of the meeting, we really want everyone's cameras on, I would turn my camera on if maybe I didn't already have it on. So things may change just by making that announcement. If people know this is part of the norms, they might, if they just don't feel like they're camera ready, like Allie was saying, then they will know they should try to be camera ready if they can. Thoughts on that section?
Hey, Lisa, I think I agree with the preferred on language. Where I would suggest making some change is notifying the chair or ED, because people are going to have a variety of reasons and they may or may not be comfortable. They might just say, hey, I mean, people are being off camera when you have said, hey, the expectation is let's get everybody on camera, and it's still, if somebody is not on camera, then it's their professional judgment. That's how I would take it. If people want to notify the chair or the executive director, well and good. But if they don't want to notify for whatever reason, and reason could be, hey, they might be driving or they might be doing whatever, something, then it should be okay. So maybe we can tone that language a little bit softer to say, hey, prefer notify, but if you don't notify, it's nothing against you, kind of a thing. That's all I wanted to say.
Thanks, Animesh. What thoughts do people have about that?
Yeah, this is Angel. Preferred on or like recommended or something like that will be preferred languages for the council members. And yes, it is more focused, and that you can be participate more if the camera's on. But like some people need it off. So in that case, we like them to attend, even if they are not ready on camera, instead of not being able to get on it. That's what I'm thinking.
Can you repeat the very last thing you said?
Yeah. So the some people can, if they cannot be ready on camera, they might not be able to attend the meeting. So I like for them to at least attend meeting if even if they are not ready on camera. So I like to have them to have a at least the options for it, and we can put it on the preferred on or the recommended to be on, but we like to keep a little bit of room for it. That's what I'm thinking. Thank you.
Okay. Did everybody get that? Okay, so I think what this actually says specifically as of now is if you need an accommodation, notify the chair or executive director. Saniel and Animesh, are you saying that we would take that part totally out or rewrite it or say notify the chair or executive director if possible? Because right now that only talks about if you need an accommodation, not if you just are not going to be able to have it on for whatever reason.
Yeah, and that notification, I mean, like for example, somebody might be on the camera for 1 hour and then might have to go off camera for 15 minutes or half an hour. Do they notify? I mean, we all can see if the individual is not on camera or on camera, right? So that notifying might just place kind of I mean, how are they going to send? I mean, text, email, and then is the chair or ED going to see it all the time? Hey, I'm on the camera now. I will be off camera for 15 minutes. I'll be again on camera at 1 o'clock. Those kind of logistical things. So we leave it to the professional judgment of the individuals, because everybody being on the council itself is self-aware of their ask. So I think notifying the chair is good, but not requiring it might be the way we can go with it. Maybe you can wordsmith it a little bit, but that's the intent of what I'm trying to say.
Okay, got it. So I think.
Hey everyone, I know I'm the last one to the party, but what's the goal of this? In other words, I mean, should there be a notification ahead of the meeting? Because, for example, to use that example of I'm going to be off for 15 to 30 minutes, will there be a timely enough response to interrupt a meeting to let someone know that something came up, you need to go off camera? I mean, it seems to me that if someone knows they're going to be off camera, that notification should be ahead of time so there can be an awareness prior to the meeting. Does that make sense?
I'm going to just stop right there, because I think this is, we're getting a little confused with what this actually says. And Animesh's example of, I got to run and pick my kid up and I'll be right back kind of thing. Nobody is saying that you need to formally notify anybody of something like that. In my mind, this speaks more to someone who's joining the council who knows I'm probably not going to be able to be on camera.
Gotcha.
And
yeah,
so that's and also it's not like we're going to take away your birthday if you don't follow this rule. You know, this is not like a heart, right? I mean, it's not a policy. So this is really more of a
guidance.
Let's just all try to be on the same page thing. So
Agreed, Lisa. And I think that makes sense. Maybe we can reword that piece because, I mean, we on the council, I mean, definitely got confused and got clarification. Anybody joining new and reading this and not talking to somebody might just get that impression. So maybe if we can clarify that, maybe asking ChatGPT and say, hey, how do I wordsmith this to be better accommodate what I'm trying to figure out. But yeah. Does that make sense, Lisa?
So I think we all agree with the rationale section, right?
Yeah.
Okay. So we're just discussing that first part.
Yeah.
Yes, that first section.
And specifically saying, hey, this is recommended, but as you said, your birthday is not going to be taken away. Somehow we need to kind of clarify that this is council's expectation, but if you don't do that, then no strike against you, kind of a thing. Somewhere we need to clarify that.
Would people feel comfortable with just striking that section that says if you need an accommodation, blah, blah, blah? Is that something, Emily, that would normally be discussed before someone comes to their first meeting anyways?
It is, but I think the kind of special circumstances, kind of like Rachel was saying, in her experience, there had been a couple months unexpectedly where she knew she wasn't going to be able to be on camera, so she's not been on camera. But if those special circumstances weren't there, she would have been on camera. So I think being transparent about kind of those situations would go a long way. But we do talk about accommodations when people join the council. That's how we know that there are some people that have already told us, I'm not going to be able to focus if I'm on camera. I'm going to be off camera, but I'm still going to be using chat and I'm still going to be talking during the meeting.
And perhaps the wording could say the preference, because it really is a preference versus a requirement. I think there can be active participation with or without a camera on personally, but I'm with everyone else. The preference is to see faces and to interact with each other. So maybe again, the wordsmithing could be a little more that direction.
Can I call him? Okay. All right, William, I'm going to call on you. I know you're not on executive committee, but.
I was actually going to ask beforehand what the rules were, if this was okay or not. I just want to put in a reminder as we're talking about this. I just thank you so much for the efforts on this. My understanding is that us as a council, our whole purpose is to take people from a variety of backgrounds and experience. Turn it off. Sorry, and affect the greatest amount of change that we can. And so, the research on that is that 2 of the 3 components of high producing teams is pro-social purpose. And so I appreciate starting out with the purpose of the council and why we are setting this up. And the other one is psychological safety. And so just as we're talking about this, I think that if we go through the lens of how are our personal decisions affecting the most change within the council and ultimately leading the council to affecting the most change, I don't know, I just think that's a great framework to keep in mind and to have that reminder as we have this discussion. So.
Go ahead.
Madam Chair, Ashley is on the chat. She says, so the reason I am not typically on camera is because I feel like I move a lot and I feel like it could be distracting to others. I'm also not on the executive committee, but I just had time to get on here today.
Okay. Tony, I'm calling you out because you're usually our wordsmithing dude.
Okay.
So specifically, I would like to figure out what we want that section, the norm section, to say.
Okay.
So I think people do not want it to say it's required.
Right.
That it's preferred. I think it's important for it to say to strengthen connection and discussion, because I do think it strengthens connection and discussion. As I think when we were all in the room together last time, our discussions were much more productive. So that's my 2 cents. Allie's shaking her head.
Madam Chair, I think you're off to a great start. I don't know that you need me to wordsmith, because if we start with to strengthen connection and discussion, the preference is to have cameras on to be able to gain communication beyond the verbal, to include body language and other inflection. I don't know how else to word that, but I think you're off to a great start. Do we want to do that right now, or do we want to come back with this?
Like to be doing it in real time as we go through it, because we
Okay.
do have a lot of time set aside for this. So I'm hoping that
Awesome.
most of this will be a little more straightforward.
Sure.
One suggestion, and this is I'm thinking out loud, Lisa, is at least have the camera on while speaking. If you're not engaging or if you're not speaking, it might be okay or something. And again, that's where the wordsmithing will come. But at least have the camera on when you are directly speaking to the council or presenting a point or somebody's directly talking to you. In that case, have the camera on so that there is that direct engagement, unless there is a specific reason or unless you don't feel like. So
And I think
making that expectation clear that while we are talking, at least have the camera on. If it's off the other time, it might be still kind of okay, not taking your birthday away kind of a thing.
Tony?
Thank you. Actually, Animesh, I agree 1000%. And it kind of ties into what Ashley was sharing earlier. Because if someone is not speaking, and for example, as you were talking right now, if I was over here doing this or moving a lot or doing the YMCA or something like that, it would really distract from what you were sharing verbally. So if someone had the need to have their camera off to minimize the motions and to minimize any potential distractions, I think that actually would be preferred in a lot of cases, so that those are either in the room in Jeff City and looking at the screen, and or those of us that are remote and looking at the screen, there's not a little box that has someone doing this, because that could be very distracting if someone is speaking. It really could. So just my 2 cents on that.
Allie?
On the other hand, liking to talk to a screen of black boxes.
In case you didn't catch that, Allie said it's also very distracting to talk to a bunch of black boxes, meaning on the screen. So as the few of us who are here trying to look at who's on camera, who's on hybrid, Allie?
Yeah, I think if we're here live, you know how to sit here and pay attention and etiquette. So if we're at home on Zoom, why can't you be that respectful? Show that much etiquette at home.
Did you guys catch what Ally said? Does anybody need me to clarify? I think it's all in the captions. I am rereading the way it's written and I'm wondering, it really never says that it's required. Everything there says preferred. If you need an accommodation, you're going to tell somebody anyways, I think, or Emily's going to hear about that when people are new so that we know what to expect when they're coming to their initial meetings. Go ahead, Animesh.
Yeah, maybe can we just say this as the best practice? I mean, that way, hey, these are the best practices. I mean, if you indulge in that, that's great. But if you don't, I mean, no harm. So that way it can take away that edge from a lot of people who might say, hey, this is what everybody is looking at. And if I'm not on the camera, I'm going to be looked bad upon kind of a thing versus, hey, this is best practice. Because of it encourages the participation and all those things that we are already saying, hey, these are the best practices to kind of be on the camera when possible, as much as possible. But if you're not, it's okay. Something like that.
Go ahead, Tony.
Oh, I just put in the text or in the chat. We could just start the sentence with, as a best practice, comma, keep cameras on during hybrid meetings. That might cover it. And really, everything else might just flow. I really don't know how much more rewording we need. Because I think that may cover all the intent and cover all the bases, unless there's something else I'm missing.
I think that works. Does anyone else feel differently? Allie is shaking her head no. Rachel's trying to get in. Oh, okay.
I think we have beaten this to the death. So
Okay, so we have that small tweak to the first section. And we all agreed the next section rationale was fine. So now we're on to round robin before making any decisions. And the norm would be before any vote or major decision, the chair conducts a brief roll call invitation for comments. Members may say pass, share verbally, or drop a chat note. For example, Allie, do you have anything to add? Tony, do you have any concerns? This is sort of going back to people who process differently, making sure we know. What's so funny? Stop. So that we don't miss, giving someone an opportunity to speak up. I think this is especially hard to do when people are online because, if they don't raise their hand quickly enough or don't know how to use the raise hand feature, or somebody doesn't see them, how do you all feel about kind of getting called on? Making it clear that people could say, I'm good. Ellie says she likes it. Animesh is giving 1,000,000 thumbs up. Maybe Animesh needs to give a little presentation on Zoom reactions for people. I made a note somewhere later on in case I forget to say it. You know, I can never find the raise hand fast enough, so people can literally raise their hand if they're on camera. And I believe Shannon has a whole screen of faces where here, like on the screen we're looking at, we've got the presentation and only a few of you showing up. So somebody will be able to see everybody who's online, but that's down further. Okay, so we're good with the norm section. And then under rationale, we basically, what I just said, to make sure that we're not leaving anyone out, people have the opportunity to speak if they have something to say. Okay. The next section is going to be really hard for me. Embrace the silence. So the norm is after prompts, the chair allows quiet thinking time. Don't rush to fill the silence. And the reason that we want to make sure we're doing that is that it respects different processing speeds, and also what comes out of silence is brilliance. And sometimes, regardless of your processing speed, the more time you have to sit and think, you might come up with an answer that you didn't have right off the bat. We're laughing because I said I'm going to need a timer because this is painful. I like to talk, in case you didn't notice. Tony gave thumbs up. Danielle says thumbs up with his hand. And Rachel and Rachel, if you had anything, just let us know. She's got a thumbs up also. Okay, next section. Multiple ways to engage. Participants can use verbal comments, raise hand, reaction, or chat. Staff will monitor chat and alert the chair. Like I said, Shannon or somebody in the room will always have a full screen of everybody that's online. So whether you use your actual hands to raise your hand or use the reaction, we should catch it. Tony, what have you got to say?
I just want to make sure you caught that. It was just a little test.
Well, I didn't pass until Emily said Tony's got his hands up.
He was still caught. You know, I was just everyone passed the test. It's all good.
Okay. Okay, nope. All right, the next section is Zoom etiquette quick hits. I think when you come to a meeting, you get a binder that has this in it, but we want to just make sure everyone understands these rules. I had kind of made was thinking to myself, maybe we could make something to hand out the next time people are here, or mail it to them so they can have it not only for these meetings, but anytime they're at an online meeting. So mute when you're not speaking. If you accidentally do not, I know somebody from here will be able to send you a message, or maybe they're even able to mute you, you know, if your dog starts barking and whatever. Use raised hand. We already talked about that. State your name when speaking. I know Catherine's great at this, but if, especially again, when we can't see all the faces from here, it's just nice. Plus it's easier for the captioner and for minutes and all of that. So just state your name before you start speaking. Feel free to turn off self view. Sharon, when she was here, was talking about how she hates to look at herself. I don't know how to do that. I'm sure someone does. So if that's a reason that you would be having trouble focusing because you're looking at your own self, we can explain that to people. And then use chat for brief points or links. It's hard for people to focus on what people are saying if the chat is blowing up with big, long paragraphs of information. So I'm not sure how we will work around that, but the chat for brief points. Tony? Tony says four score and 7 years ago. Do you know it? If you know it, go on.
I was just going to put a really long text there, but I didn't know any more to put. So, just kidding.
Go ahead.
Kim asks, one thing could be that have a photo of yourself if you're not able to be on camera. That way it's not just a black box.
Excellent idea.
Yes, and make sure your name is showing up. I don't know why on San Yiel's it only shows up when his camera comes on, or even when his picture comes on. It's weird because usually it's on there. And again, if that's something you don't know how to change or fix, we can help you with that. Anybody have anything on that? Emily's just adding those two things. Yeah, update your name. Okay, the only changes were those last two things that Emily added. So I don't see anybody's hand up. Let's move on to section 3. Accessibilities and supports. Captioning is standard interpretation available when needed. Build ASL interpretation and translation line items into planning as seen in the Olmsted budget outline. Okay, and then this is sort of where we start with the quote unquote script that we talked about in the meeting, that we would have like a little quick thing that the committee chair or myself would read at the beginning of each meeting, you know, about the expectations, basically to synopsis, to I guess, pare down what's in this whole document. So we would start the meeting saying, if you need an accommodation, camera off, extra time, alternative format, or support, please tell the chair and we will adjust. Sometimes that does have to happen on the fly if we didn't know ahead of time, but that's why we have all these smart people in the room able to figure out all this technology. Okay. Section 4, pre-work and processing time. The norm is that the staff distributes agendas and minutes well ahead the chair's pre-meeting email, which I don't know what that is, so we can talk about it. Highlight items likely to need discussion and encourages member to prepare comments or questions. When the meeting invites come, all of the attachments are there for things that you should be looking at before you come to the meeting. There are interviews happening now for new members, and we're trying to make it really clear to them that you should be showing up ready to talk about the things that your committee is going to talk about or the full council. So this is just sort of a reiteration of that. And then the opening foundations, I don't know if we want that to be the name of what we're going to read before each meeting, but before business, the chair restates A, the purpose, B, the camera preference and accommodations, C, participation channels, and D, roll call before vote. So it's just going to be a reminder to people again of why we're doing what we're doing. No thoughts on that. Can we move forward to number 7? That is the actual meeting foundations. So this will be on all the agendas. I guess we can discuss, do we want to read this every time? I'm on other boards where we do read things like this every single time before a meeting starts to just remind people why we do what we do. So we give the welcome, we talk about the participation, how ways to engage, thinking time, what's going to happen before the vote, and accessibilities. Tony?
Just for perspective, 60 seconds is not much to set the expectations up front. I've been in consulting environments where they've taken 15 minutes to do safety plans and to outline all the exits in the building and to talk about all kinds of safety equipment and to go over all kinds of things. So really, it's not a very big ask to do even 2 to 5 minutes, but I think it's great just as a reminder for everyone to be on the same page. And that's just my two cents on that.
So you're saying keep it as is, read it, plus have it on the actual agenda.
Yeah, I think it's a great idea. Yeah.
Allie says she agrees, but she's over there cracking up because she sees me waiting, knowing that I have trouble waiting. Animesh, Rachel, or Saniela, you have any problems with this? Because I do feel like this is sort of the big deliverable out of all of this. So I want to make sure we all are in agreement. Animesh, I think your hand is up.
Yeah, I agree with Tony. I mean, I think this is a great idea, and putting it on the agenda, the first part of the written agenda, as well as speaking it out all the time, reading it out all the time, will basically set that expectation for the start of the meeting. So So I agree. I mean, this is something that we need to do to kind of set the tone of the meeting, even during the executive committee meeting or any meeting. So this is good.
Thank you. Let's give it a thumbs up. Okay, let's, if we can go back to section 5. The onboarding and peer mentoring. This is something that's been discussed since I started 5 years ago. So this is a little more straightforward. So the first section says the chair's post-meeting check-in for new members. For a member's first 2 to 3 meetings, the chair or designee will text or call just to quickly ask how did it go, any questions or preferences. That would be a way for people to say, you know, please do not call my name. I can't have my camera on for whatever reason, things like that. And then after those meetings, we talked about peer mentoring, where we could offer mentoring to new members after they've been to a few meetings, whether or not that would happen naturally. I know just from being in Jeff City, you know, you may be drawn to certain people because you have similar interests on the outside, or you sit next to one another or whatever. So more of a, I don't know what the word is I want, more of a natural sort of way for people to connect, as opposed to, okay, member A, member B is going to be contacting you. Okay, so we're good with the A and B sections. All right, C is something that we discussed is available for the technical piece of things and some training so people understand what is going to happen in the meetings, et cetera. How do we, Emily, currently share that kind of information with people?
It's usually in their first couple months of being a new member, so this might push it back a little bit, but I send them access to the trainings or recommended like websites to look at. And then when we set up a meeting, whether that's a small group meeting or a one-on-one meeting, we talk about the material that I sent ahead of time.
And I'm curious, does it feel like people are doing them, or more importantly, are they getting something out of them that will help them in the meetings?
I think it's a good foundational step. I think the most impact is when they're talking to staff over the next couple months. So like we might give them a training about lobbying, which is great information, but it doesn't really hit home until they're talking one-on-one with Christina about what lobbying really looks like and what we avoid and what we do. So I think it's a good foundational step that we then can jump onto as staff.
And I do think, for me, I don't remember doing a lot of those ITAC trainings when I started, and I didn't even know what I didn't know. I wouldn't have even known what to ask a staff member. So I do think this would give people just, you know, enough information to know what they want to ask and what they want to learn about. Okay. Okay. Section 6 is meeting structure and time management. Assign a time window for discussion. If more is needed, move items to the parking lot for a follow-up. I think we do that already. Clear decision capture, state motion, seconds, and outcomes via roll call, especially for hybrid meetings, so members feel seen and heard. And then relationship space for in-person days, consider brief social time to reduce hesitation and build trust. And then for hybrid, a 2-minute opening share can break the ice. What are people's thoughts about that last piece? All right, go ahead, Animesh.
Yeah, so that relationship space, I think it's more of an advice kind of a thing. So I'm not sure if that belongs here versus, hey, this is how you generally do, because this is kind of, hey, how do you build relationship, or I mean, find a coffee time or icebreaker or something, right? So I'm not sure if that belongs directly here. Maybe we can take it out and carve out, hey, other best practices to kind of make your meetings more effective or efficient, and here are the 5 things. Reach out to people, meet people at coffee break, talk to them, whatever. So I just don't think it belongs here in specific point number 6. Maybe it belongs in just the general section.
Okay, I hear what you're saying. I think this came out of our conversation of people, when they feel more welcome, will feel more inclined to participate.
Mm-hmm.
But I hear what you're saying about it being in here. I wonder if we could somehow roll it into section 1. We have something that says relationships matter. We will make space formally and informally to build trust across geographies and modalities, in person and on Zoom.
Yeah, and I think this is the overarching thing, right? Because it applies to everything. So maybe it's a bigger point. I mean, it's the umbrella point, and then underneath all this comes, hey, we're talking about relationship out here, and so it applies to point number 1, 2, 3, 4, 5, 6. Everywhere you go, the more comfortable you are talking to each other, the better it is. So maybe in point number 1, or even above point number 1 somewhere.
Hi, Emily.
So when I talk to new council members, at least the last couple new council members, this is how I've been talking about it. I've been talking about, like, the agenda tells you what we're going to talk about, how much time and what questions to think about ahead of time. And I talk about, there will be voting, and here's what that looks like. And, here's what you can expect. The first couple meetings, you might not vote on anything because you're not in a committee yet, and that's okay. And then I do emphasize the relationship space in the meetings. So I tell people lunch is a really good idea. If you can make it to lunch, we would love to see you at lunch. You can arrive a few minutes early. That's a good time to chit chat, ask people their names so you can, in case you've forgotten, ask people, that you want to sit next to you, that kind of thing. So the relationship space has been, I think, because the emphasis, over the last year or two has been built into the design of the meeting, and people are being coached on that before they get here so that they can know up front that we have an emphasis on that relationship piece in the meeting that's just beyond, like, the agenda. So I don't know, can we have it in both places? Because this does match kind of how people are guided as they come start joining our space.
William?
I just wanted to ask if it could potentially go under number 2 for the participation norms. We have other bullet points in there that are not necessarily expectations, but are frameworks for what the council will do to allow for that participation. I feel like this could fall under that as well.
She loves it. That's her favorite. That's why she's here. I hear what Emily is saying, and I would just kind of remind people that this is not like a rule book. Could we maybe in the first section just add a sentence that says something like, for example, things like social time at in-person meetings, or 2-minute share time, icebreaker, whatever. And again, with the assumption that people can pass, they can say, I don't have anything.
Yeah.
Tony, is that good for you? Does that make sense?
Yeah, I think that's great. You know me, I will generally not pass. I'll always have something.
Same.
It's all good.
Danielle or Rachel, I don't want to leave you out if you have something about the relationship building piece.
All good.
Okay. Awesome. Okay. So section 7, we already talked about. Section 8. Zoom etiquette card, which, like I said, is in the binders when you're here. We can get something like that made, I guess, for people, right? Do we send that as a document attachment? Okay, so we can implement something like that just so people have these things front of mind. Oh, sorry, Allie, go ahead.
Can we put that on the back of our name? Oh, that would help. Never mind. Never mind.
Oh. Did you say put it on the back of the name cards? Oh, so you would have it in front of you. Yes. Allie was saying on the name tags, they put on the table on the back, it says, raise your hand and wait to be called on and use your microphone. she was asking, would it make sense to add some more of these items? All right. On the top of page 5, just the last thing under Zoom etiquette, fan favorite. It's okay to knit, doodle, or fidget. Please stay present and tell the group if a focus aid means we will see the top of your head. Jada and I are like, right on. All right. All right. And then the last piece is the plan. So the first thing we would do before July, July meeting, draft and circulate the meeting foundation one-pager and openers. Add the round robin before vote line to the agenda template. That'll just be something staff does there. And then another piece of information I think we discussed was just for current members to have a profile sheet, like a one-pager about themselves. That might, I don't know where we would put that, but then the new members would be able to sort of connect people. And if, somebody they met at lunch, they wanted to connect with, what's happening? Oh my gosh, what is happening?
I think this is Emily. I think Allie's working on that in EOC. I'm sorry.
So it's happening. Somebody might take your picture or ask you for a picture. And then during the next meeting, read the 60-second opener, apply the silence norm and round robin, and then after ask new members privately about any participation preferences or accommodations. And then after the meeting, we would start doing the plan to have the chair text or call new members for a meeting check-in, and then ask if they know if they want to opt in for mentoring after the first few times they come. And then, of course, tweak anything that didn't work, things that need to be added or not done. Okay, so I'm assuming everybody's fine with this implementation checklist.
Yes.
And going forward this way. Okay. So I will need a motion to approve this. What are we calling it? Meeting ground rules, council engagement ground rules document. Does that name work for everybody? Or do we not want the word rules in there? Fine here.
Yes. Rules are fine.
Foundations and etiquette is the name of the document. So do we want to stick with that?
What is the name of the document? What is?
Foundation of the etiquette.
Yep, that works for me. Foundations and etiquette document.
Sounds great.
Okay, so if we're all good, I'll need a motion, a second, and vote.
This is Sangha. I'll make a motion.
I'll
Neil for our
second.
first. Oh, Tony's a second. Can I get a roll call, please, Tony?
I'm sorry, I wasn't here early to have that document open. My fault.
Hold, please.
I think I can do it. Let me stop share real quick. Yeah, I got it. Lisa?
Approved.
Allie? Animesh?
Approve.
Tony?
Approve.
Rachel?
Approve.
Jing-Yil?
Approve.
I think that's everyone. Did I forget anyone?
Awesome. Thank you guys for getting through that. And we are literally right on time, 1 minute early. I appreciate that.
Good job.
Huh? Will we present this to the full council tomorrow? Yep. Okay. So we will just present it in the update next week or tomorrow. Sorry. Okay. And then the next item on the agenda are the public comments. Emily's going to walk us through this document that has itty bitty tiny writing on it.
Yes. So we put this proposed 5-year state plan out for public comment. We created a Google form. We shared it in the newsletter. We shared it on social media. We shared it in professional networks that we have. And it basically just created a comment box per each goal for people to give us feedback. The process for us is if there are substantial changes that this committee decides to make to what we've already proposed, it would have to go back out for public comment again for 45 days. If you make no changes to our proposed goals and objectives or just minor changes, it does not need to go back out for public comment. So we received 35 responses. Some were not really giving feedback. Some were just engaging in the survey form itself. So we'll just go through it. When I looked at it, I did not see any requests for substantial changes. But you guys can kind of talk through. So I'm just going to go by goal. So we have 3 goals to look through. So that's column B on your screen, the second column. The first comment, I love the advocacy goal. I think it would be great, in addition to the 3 self-advocacy groups, to have a caregiver advocacy group as well. I love the inclusive community and recreational objective. It's much needed, especially in more rural parts of the state. And then the next comment was somebody told us our phone number was incomplete. The third comment, can you scroll so that it's reading? Okay, thank you. I'm sorry, I'm looking for teach by doing what? Zoom calls, conference training, how will the council improve access? And that's more of a work plan question. That's something we figure out when we're crafting the work plan, like how are we actually going to implement this goal and these objectives? So that's what they're looking for there. They're asking us about how we're going to actually do it. The next comment is about SMART goals. So I actually had this person call me. She's a teacher and she does a lot of IEP goals. So she talked to me a lot about SMART goals and she had some recommendations for rewording ours to, in her opinion, reflect SMART goals. The next comment was that the objective needs to be measurable. Next comment was very much necessary. I continue to learn and desire to improve advocacy means. The next comment was that they agreed with these goals. The next comment was that training needs to happen across the state. So again, that's really where the work plans come in and how you guys craft projects and the scope of work in your projects. So that's not necessarily a goal specific feedback. Another comment about measurable, making SMART goals. Support for transportation. They say it's critical for community belonging. Another comment about measurable goal. How many people is what they're asking. A comment about, in my experience, this section needs to be amended to specify non-passive and repeat conveying of awareness to parents and guardians of the individual and community advantages of benefit support utilization. So I guess that's a call for bringing in more caregiver work. The next comment talks about maybe bolstering supported decision-making in the goal. The next comment is we need training and strategic mobilization around advocacy for public transit. And let's see. Sorry. Next goal, or the next feedback is from somebody with a developmental disability, and their hopes that the council would create groups where other advocates can gather and share experiences and ideas and help the council make effective policy. The next comment is about businesses not knowing how to become paid with job coaches, or I think it's supposed to be Voc Rehab. The system to become registered with the state is very complicated and lengthy. Transportation is not available for many job opportunities. Self-directed staff do not get reimbursed for mileage. One person commented, that sounds good. One person said all of the above objectives could be more effective and powerful if area organizations could join forces. So that's a little bit into the work plan part of it, where we focus on, like, are we going to build coalitions and networks to try to achieve these goals and objectives, or how are we going to do that? And the last comment, most people and families in the community have no idea about this. There needs to be a big focus on getting the word out. So that was all the feedback we received for goal 1, which was about more people with developmental disabilities and their families will have the skills and opportunities to speak up for what they need. And then we had 3 objectives under that goal: a training one, an empowerment, and community belonging. Any questions about the first goal feedback? We move it so that this row C, yeah. Okay, I'm going to keep going. So the second goal was, we've proposed, are more people with developmental disabilities will gain greater community access that is tailored to their needs, helping them live confidently, independently, and happily. And then we had 3 objectives under that: a healthcare partnership objective, a patient right objective, and transportation. I think Animesh. So again, we had some suggestions about SMART goals and needing our goals, our objectives need to be measurable. Somebody said amen. Somebody said agree. Somebody commented about dentists, nurse practitioners, and MDs on how to communicate with people with developmental disabilities and look at old projects. Do not copy, but learn from them. And self-directive. Another comment about measurability. Somebody said they're glad to see transportation. Goals should be measurable. Should work with state legislators and county officials to advocate for funding for public transportation and wider ADA transit. Again, that kind of strategy would really be in the work plan, not in the goals and objectives themselves. Helping disabled persons, and also importantly, caregivers, parents, and guardians understand how even some basic hygiene routines are essentially important to avoid miserable and costly health consequences and complications in early adult and midlife. Somebody mentioned TASH, which is a self-advocacy organization. They just received a grant to work on Medicaid support. Somebody said, bravo for objective 2.3, expanded, accessible, and affordable transportation is critically lacking. Someone said their hope is that the council address concerns related to access to needed personal care attendant services and an overwhelming desire to work. Medicaid is the only insurance to cover PCA waivers for people with disabilities, and these waivers are needed to fund care that is desperately needed for people with developmental disabilities to live and function in the community. However, Medicaid is very much an income-based program. Whenever somebody with a disability decides to work, they immediately get cut off from services. Someone commented that parents and guardians need specific instructions navigating the Medicare maze now that they're retiring and need employment that assists nonverbal developmental disabled adults. Somebody said transportation to appointments is a barrier to appointments with undependable systems with Medicaid, OATS, and Medicare reimbursement, very restrictive, causing no-shows or last-minute cancellations or late appointments. Somebody said, sure hope DSP isn't cut. I assume that means direct support professional funding. And then somebody said, agreed. Any questions about goal 2 feedback? Okay, goal 3 was the goal itself was about more people with developmental disabilities, their families, and employers will gain information on the benefits and impact of competitive integrated employment and the value of hiring people with developmental disabilities. And then we had 3 objectives under that goal: awareness, benefits, navigation, and employer education. Some of the feedback we received is it would be great to add in an objective about reaching out to schools to make sure every district is aware in providing transition services. Someone's asking, how are we going to do that, which is more of a work plan question. Somebody says, I support these goals and objectives. However, I encourage the council to not forget there are kids and adults out there that have such severe disabilities, they will never be able to participate in many of the community-centered objectives. These people will often be best served and enabled by helping families care for them in the home and in a safe and healthy manner. In these situations, the goals and objectives aren't going to get them to engage in community activities, employment, education, etc. Someone's provided some suggestions on SMART goals. Someone said this was the most specific, strongest goal that we had. The objectives need to be measurable. Someone said very much needed. Someone said agreed. And someone said, look at workshops to see how to support people with developmental disabilities, find out how VR and other agencies do this. Another comment about SMART goals. Somebody said transportation is critical to finding and keeping competitive integrated employment. Someone said don't focus just on traditional jobs. Teach people about the PASS plan for SSI. Someone said dental health care is lacking for our Medicaid population. Someone said an issue of transportation funding and availability for disabled adults to get to and from their workplace. Someone made a comment about strengthening the language of one of the objectives. One person commented about having an explanation of benefit for paid Medicaid expenses. Access to reliable transportation would result in a marked increase in competitive integrated employment. I cannot expand this one. Here we go. From a very young age, I've had a strong desire for employment. However, because of my disability and my need for personal care attendants to assist with ADLS, I've only been able to maintain part-time or volunteer positions in order to stay within the guidelines outlined by Medicaid. I wish that a program could be designed where people that need assistance with ADLS could get the help they need and have it not impact their income level. ADLS is daily living, activities of daily living. Thank you. Difficult to weekly and yearly understanding of the work systems and the impact on SSI. Somebody said sounds good. Somebody said an incredible need for training employers. Somebody made a comment about there needs to be incentives for them, employers, to hire those with disabilities. Any questions about goal 3? So I think at this time, if there's no substantial comments, the proposed draft plan would go forward to ACL August 15th.
Thanks, Emily. Now's your chance. Anybody have thoughts about anything in the public comments? Are we all good with the way it is? And if there's no, Animesh is giving thumbs up. If there's no substantial changes, I'll need a motion to move forward with the state plan.
This is Animesh. I make a motion to move forward with the state plan.
Okay, I got Ally as a first, and Animesh, can you be the second?
I can be the second.
Awesome. Then can we get a roll call?
Okay, Lisa, Ally, Animesh,
Approve.
Tony,
Approve.
Rachel,
Approve.
Cheng-Yil.
Well,
Great. I'm happy that's over. Okay, Next, we have approval of January minutes. Okay, Ally's made the motion. Oh, wait, this says January. It should be March, shouldn't it? Okay. Okay. I only see it on here once, but okay, we're doing January 1st. Okay.
I'll second.
Okay, Tony second. Can we get a roll call?
Okay. This is Emily. Only vote if you were in attendance for the January meeting. Lisa,
Approve.
Ally, Animesh,
Approve.
Tony,
Approve.
Danielle,
Abstain.
abstain, Rachel.
Approve.
Motion carries.
Okay, great. Now can we approve March minutes?
I'd like to make a motion to approve the March 2026 Executive Council minutes.
Thank you, Tony. And Ally is giving a second. We need a roll call. Only vote if you were here in March.
Lisa,
Approve.
Ally, Animesh,
Approve.
Rachel,
Abstain.
abstain, Tony,
Approve.
Danielle.
Approve.
Thank you.
Great. It's lunchtime. We don't have to take a roll call to go to lunch, do we? Okay. We're having lunch here. Go have your lunch. We'll see you at your committee meetings. Thank you all.
Thanks, guys. Bye-bye.
Appreciate it.
Thank
Bye.
you.
Thank you.
Okay. Emily, can you hear me okay?
Can you speak a little bit louder?
Is that better?
Or maybe it's our mic. Hold on. It's our audio in the room. Hold on.
Okay.
All right. Say something again.
Is that better?
Yeah. Thank you.
Okay.
Yep. We're good.
Okay. All right, everybody. My name is Rachel Baskerville. I am the Project Development Chair for MODDC. I have 12 o'clock, so I think I'm going to call this meeting to order. I don't see Tony, so Emily or whoever's in charge, can I get a roll call?
This is Shannon. Rachel,
Thank you. Yes. Here.
Allie, Colette, Jordana, Lisa Nothouse, William, Nadia's here. Ashley, Andrea, our roll call shows you do not have a quorum.
I thought the room looked pretty empty, and online looks pretty empty too. Emily, do we want to continue to discuss or give it a few minutes?
Rachel, this is Emily. It's up to you. Kim is here and Nadia is here. Is Kim on the, sorry, one quick question. Kim's not on the committee. Okay. You can start talking about things. You just can't do any motions.
Official business. Okay. So I have Nadia and Allie, I think, is on TDC too. Or is she just a guest?
Does Jordana make a?
Oh, and I see Jordana's signed on.
Yep. Sorry, I'm late.
That's okay. We're just trying to see if we have a quorum.
You do have a quorum now that Jordana's here.
Okay, perfect. All right, everybody. So did everybody get a chance to see and listen to the recording of Emily and Ashley discussing the blue envelope? Well, yeah, I'm sorry, yeah. To the blue envelope project that Ashley keeps talking about and keep mentioning in meetings. I see a thumbs up from Jordana. What are your all thoughts about it? Is it something that the project development committee wants to put more funding towards so it can be a statewide program? Because right now, I think according to the recording that Emily and Ashley did, is only in Cape Girardeau County right now. So is this something that we want to make statewide? Go ahead, Jordana.
Yeah, I thought it had been mentioned previously that perhaps it wouldn't be an allowable use of funds to just extend the same program statewide because it wouldn't be a new or like it somehow wouldn't meet the parameters. Am I making that up or did I mishear something?
I think that's what we had discussed in the past when we talked about certain projects, but I'm going to let Emily kind of answer that for us. If Emily, if you don't mind, because I know you and I had emailed what the difference was and what you had researched.
Yeah, so so we cannot supplant. That's in the DD Act. So when I did some research, there's a difference between supplement, which would mean to add to something, versus supplant, which means to like replace something. So if there was interest in using council funds to supplement the blue envelope program, that would be an allowable expense. William has his hand up.
Go ahead, William.
This is William. Oh, that's sorry. Sorry, I can't tell if it's on. I was just had a question, clarifying question about is supplement. I mean, is that what we would be doing if we moved forward on it? Like, my understanding was that it's kind of grassroots efforts, right? Like, there's not any official funding for this or anything like that, right? So we would be looking at taking on kind of the bulk of that, the majority of the funding if we move forward on it. Is that correct?
From a state level, that's what I understand. From what I understand from the recording that Emily and Ashley did, there was some county funding in the Cape Girardeau from local county organizations in that area, but nothing statewide. Did I understand that correctly, Emily?
I believe that's true. And Zanetta put a comment in the chat. Springfield, I believe, through their SB 40 board, has provided some funding to bring it to Springfield.
And I was going to say the same thing because I saw something in an article from another organization down in Springfield announcing the blue envelope program down there as well. So it's slowly getting out there, but not still hasn't reached fast track.
Jim has his hand up.
Go ahead.
Sorry, this is William again. I forgot, I failed to mention, for what it's worth, I love the idea of the program, and I fully support bringing this to the council to talk about funding it. I think that it just was a phenomenal framework that they have set up. And I think that they've done a lot of the hard work and working out logistics of it. I know it'd be different for each county, but I think promoting that would be a great use of funds and time and resources.
Thank you, William. And I will say I agree with William, not just on a professional level, but because I am a self-advocate as well. I think it's important to have that information and that vital information available to anybody that doesn't understand people with disabilities or the uniqueness of our communications and things like that. So there's not any misunderstandings or miscommunications. But those are just my thoughts. Kim or Nadia, did you have any other comments? I didn't have my chat pulled up.
Nadia put in the chat that it looks like a good program. I wouldn't be opposed to funding it.
And Jordana put a link in there from the Springfield, about the Blue Envelope program. Thank you, Jordana. Go ahead.
Yeah, it looks like there may be Blue Envelope programs, just in a quick Google search, maybe in Kimberling City and Weatherby Lake, Missouri. So it looks like it's maybe kind of spreading grassroots. So I wonder, I, I'd be curious as to what the funding of the Blue Envelope project program would look like if it's like an education to police departments that it exists, if it's starter kits for cities that want to join in. Because since it is a kind of a police-based program, I think it almost has to be like city, county, like each one is its own individual entity, so it's hard to do. I don't know enough about implementing something through law enforcement to know what that would look like.
Right. No, and that's a valid point. And I'm wondering too if I don't know who our connections be other than like through the police departments where they work with what's the other program that I'm thinking of? Is it the CIT program that a lot of the police departments do nowadays to where we can maybe reach out to them or to that part of the departments to see if they would be willing to do the Blue Envelope program, but I'm not sure who that would be. And someone else I kind of thought about too, but I don't know how we would rope them in or if they've even heard of it. Emily, is the people that used to do the Niagara, the emergency training people. I wonder if they've heard of the Blue Envelope and if they've got connections. I'm just trying to think out of the box on who we might already know and, things like that. And I see Ashley just signed on. So Ashley, we're talking about the Blue Envelope program. So if you want to join in on the conversation and give us your thoughts, since you brought it to our attention and you're passionate about it, we're just kind of getting everybody's thoughts about your discussion with Emily and the gentleman that started it in Cape Girardeau.
Yes. My dog is being extra loud right now. Yes, so if it is possible, I guess first question was, did anybody have any additional questions over, I guess, the overview that we sent out? Sorry if I missed that.
No, that's okay. Right now we're just trying to talk about funding and how that would work in the state of Missouri, since right now it's just in the counties of Cape Girardeau and how that would look like in the state. And
I know a lot of their funding, like he explained to me, is it's not as expensive because right now it's really just getting the word out. I guess as far as funding with the training will be one of those things that's kind of hard as well. It just depends, I guess, on the trainer, but it's not really a hard thing to train people on, I don't believe. But I think he's pushing it out to first responders, police departments, and he's wanting to expand it to like hospitals and stuff like that as well. So sorry, I just
that's a good point, Jordana. I just saw your message in the chat. Actually, one of the other things that we kind of discussed too is if we're on board with pushing this program out to the state, who would we be reaching out to? And you kind of just answered that question. And who do we contact within like the police department or the emergency contacts and things like that? Through history, MODDC did work with some past agencies that did some emergency work for us. So I was just expressing, I didn't know if they knew about the Blue Envelope program and maybe getting them on board or, just brainstorming ideas.
And I am, somebody at the council, sorry, I forgot who, gave me the information for the safety and security implementation for the senior programming or Bureau of Senior Programs as well. So I feel like once people are aware, we could get multiple organizations involved because it's not just one market. It could be seniors, it could be people with autism, it could be just the developmental disability part of it too. So, which obviously that's what we take care of, but I feel like we would have support of multiple agencies because they would want their people to be covered as well.
William has his hand up.
Go ahead, William.
Yeah, hey, this is William. I just had a question for you, Ashley. I don't know if you know the answer to this, but before you had come on, I think it was Jordana had mentioned a couple other towns or municipalities or somewhere that are not exactly next door to Cape Girardeau that look like they're trying to implement this program. And so since it sounds like you're working with the guy who kind of primarily brought it here to Missouri, I didn't know, do you know of any formal system that he's trying to roll this out? Like, is that through his efforts or are these other people that have just picked up on it? Or we were trying to get a sense for what sort of funding that would look like and how that could be rolled out.
Well, so I guess they got the idea from other states because there are other states that do the Blue Envelope program, and he just wanted to bring it here. He was working with the police department. He still works for the police department, but he works through a different office, I believe. So I don't think he's handling the Blue Envelope specifically, but since he was the one that kind of was in the process of creating it, he still is in it and involved. But I know he had also reached out. We had a couple when they kicked it off for I guess the ribbon cutting. We had some representatives from the state level down as well. I believe Berger and Voss, I think. So they kind of would, be involved. And I've seen that message in the chat as well. I would assume that if everyone implemented it, it would be county because they would have to make sure that they would make sure the right people have the right training. But yeah, that's why I said I think once if we were to say, hey, we're thinking about doing this, I think other people would hop on board and possibly add some funding or a vision, I guess, as far as how far our reach is going to be.
Thank you so much for that. It definitely sounds like it's.
I think I answered your question. I'm sorry. So I actually wasn't involved in the actual Blue Envelope program as far as getting it up and going. But once I heard about it, I jumped in and was like, hey, this is great. I worry about stuff like that with my kid. If I was to get pulled over, have a wreck or whatever. So as far as the cost and stuff, we immediately had multiple agencies just in Cape that want to be a part of it. So right now, I know you guys might not be familiar, but we have Catholic Charities, which is our service coordinator in the county. So once someone has a diagnosis, they go to Sykes and Regional, then they go to Catholic Charities. Catholic Charities provides support coordination for different businesses. And the way the Blue Envelope program is now, you have certain businesses you can go to get information on the Blue Envelope program. So they've already jumped on board. And as far as funding goes, I feel like a lot of businesses will start to support. So, especially of their community. So, as far as money, that's why I said the hardest part is training. The other part is materials.
Okay, so let me ask this question. And Ashley, I know you want to see it implemented as in like you want to see it practice in the state of Missouri, and I fully support that and fully understand that. But as the council, do we want to just bring awareness to the state of Missouri and then let each county or each area pick it up? Or do we want actual funding to get it going and to implement it more than where it just is? Does that make sense? So I guess on my questioning, do we want to try to fund it from a state level so it's in the state of Missouri, or do we want to just introduce it to the state of Missouri and see if each county can pick it up as, you know, as kind of their responsibility some way and find a way for them to fund it themselves? Does that make sense? Or did I just confuse everybody?
Are you asking me or are you asking everyone?
I'm asking you, but I'm asking the whole PDC committee to see what everybody thinks.
I mean, me personally, I think it would be nice to have our name attached to it, especially since it's not here across the state yet. Just to let people know that it is something that we would provide. But I feel like I'm still kind of new on what we put money into as far as our program development. So I'm still learning on what that answer would look like. So I'm not 100% sure because I know the things we funded since I've been here since September or so. Like, I don't know if this is something you guys typically do. I just think it's a great program. And I think that everyone, it shouldn't matter what county they go through. They should be able to know that if EMTs or police or fire was to come to their rescue, that they would be able to have this training, have this envelope, and everyone knows that it is working. If that makes sense.
Yes, that makes sense.
Hand up.
I feel like if we let the county do it, there could be some counties that don't want to cover it because they don't have the cost in the rural and underserved areas. So that could be an issue. I know there's a lot of counties that wouldn't have a problem funding it, but I'd hate for some of our lower counties, like where I'm from in the Boot Hill, that couldn't afford that kind of thing because they don't really have that support.
Yeah, and
Madam
that makes
Chair.
sense. Go ahead.
William has his hand up.
Go ahead, William.
There we go. Oh, hey, this is William. I, at the risk of trying to make the data match my agenda, I feel like we have the goals and the objectives that perfectly align with what we're talking about here. If we, as a council, focus on supporting it as a project, then that's right in line with our transportation objective in our new 5-year plan that we're finalizing. And so I think that us taking a bigger portion of the action in implementing this and training it. And I think that you are I think Ashley was just speaking to this. Well, I think we all have been speaking to this, but the training component to it as well as the materials component to it. I think that we would kind of have to focus on both those aspects of it as a rollout. But I think that it fits with exactly what we as a larger council are focusing on is kind of the point.
Thank you, William. Any other thoughts? Go ahead, Jordana.
Yeah, my question is just if we decide to fund this, what does the timeline on that look like? And is that prohibitive? Because I feel like it's going to be kind of more in the future. Whereas if we're looking at, or if we look at, it doesn't have to be an either or, but the communication about the program, I feel like could possibly be implemented more quickly. So my actual question is, what would the timeline be if we decide to fund this project or a
Yeah, and
project?
that's kind of where I think I was going with, do we want the council to fund it as far as just education wise, or fund it as education and implementation wise? Because that, as Jordana pointed out, the timeline is going to be a little bit different because it's going to depend on how fast we can get the word out and then how fast we can get trainings and things going like that. I'm not sure how to answer Jordana's question without brainstorming a little bit more, unless Emily, you have some input on timeline.
Yeah, so to Jordana's point, funding would come from either 2029 or 2030. That's where we're looking at free space in our budget, unless another project turns over, right? So we have several projects that are under contract. Every once in a while, those contracts get terminated, and then we have money that we need to spend. So if we flushed out a proposal, we could have this project on the shelf as a just in case. Otherwise, we're looking at 2029 and 2023 funding. And then the next agenda item that we need to talk about is self-advocacy requirements from a project development standpoint. So that's another piece that you'll have to consider when you're funding projects.
Okay. Thank you, Emily. Jordana, did that answer your question?
Yes, thank you.
Okay. Do we have any other questions or comments, or do we think we're
I was
ready
gonna say
to?
I will reach out to Dr. Shannon and just ask him what a rough amount of costs is as far as the difference in cost for training versus cost of material, so that we would have a better understanding of what we could potentially be looking at. I know that it's just for Cape County, but at least we might be able to come up with a rough number how much one would cost for one individual. So if one individual got the envelope, got as far as the marketing stuff, and then because I think the awareness is the more important part. And then the training, don't get me wrong, they all have training. The front row of the training is what this envelope is and what this envelope does. So is it something that is going to be a high cost? So, but that's it.
William has his hand up.
Go ahead, William.
Hey, this is William. This is actually a question for you, Emily, about it. So if we move forward on creating a proposal for this project and then decide to put it on the shelf for now, are we committed to it? And what I mean by that is if we're using funds 2 years down the road and this project blows up before then and is all over the state and we kind of feel like it's not necessary, are we committed to that, or can we just say, well, times are different now?
Yeah, that's a good question. So if you guys created a proposal and voted and approved on that proposal and it got on the shelf because we don't have funds right now, but we would in the future. And then when we got to the future, if we didn't need that project anymore, it would just take a vote to pull that money back, right? So you would just procedurally, it would go through Robert's rules and you guys would be able to say, we're not going to do that anymore.
Thank you.
Okay. Thank you for the question, William. So as PDC, do we want to move forward with this and get it on the books, so to speak, for future funding?
Well,
Go ahead, William.
This is William. Finally, this time. Okay. I don't know if I need to put forth a motion. Is that officially what we need for this in this?
I don't think we need a motion at this point, but
Okay.
we would need consensus
Consensus,
of the
okay.
committee for staff to pull together a proposal that would come back for the committee to then officially approve or edit.
Gotcha. Well, I'm on board with that, Madam Chair.
Okay, thank you.
Of course, I am as well.
Thank you. Jordana and Nadia?
I agree. I think it'd be great to put together a proposal.
Nadia, are you okay with the proposal? Yes. Okay. Emily, it looks like PDC is moving forward with a proposal.
Okay, that sounds good. I'll use the transcripts from your discussion to figure out some different options.
This is
Thank-
Heather, and I just wanted to tell you that I agree as well. Thank you.
Sorry, Heather. Didn't see you. Okay. Thank you, everybody. All right. Next on the agenda is and Emily, I may mess up the initials, is the CIE? Or is it the CEI?
It's the self-advocacy.
Oh, self-advocacy. I don't know why I was thinking this something else. Okay. Self-advocacy.
We wrapped up the CIE last time, so that's
Yeah.
going under contract. Okay. Am I screen sharing for you guys? Yes. Okay. So we have a requirement through the DD Act that's specific to self-advocacy. And in the past, for people that maybe weren't part of the council at that time, the council approved funding for something called People First of Missouri, which is a self-advocacy organization, a statewide self-advocacy organization. And we provided funding for that for several years, far beyond the limit of what we should have been providing funding, because our funding is really for innovative projects that are supposed to be sustainable, not an ongoing funding stream to something. So a couple years ago, we pulled out of funding People First in Missouri, and we started doing the self-advocacy requirement through staff-led efforts. So that looked like the Access team as part of Disability Rights Legislative Day, where we were creating a self-advocacy committee that was leading the direction or contributing to the direction of DRLD. We also had the policy fellow that joined our work, and they were able to help meet that self-advocacy requirement. So we've been doing it through staff initiatives and not through a funded project. So I wanted the committee to talk about whether we wanted to keep doing that through staff-led efforts, or did the committee want to start thinking about what a self-advocacy project could look like with future funding. And again, that would be somewhere in the 29 to 2030 range, unless another contract ended early. So these are the requirements of the DD Act: activities tailored to establish or strengthen a state self-advocacy organization. So it can't just be a regional organization. It really has to be statewide. Activities so that people with IDD who are leaders train other people with IDD who may become leaders. So, we have the Power of Choice project where we will have some training components, but because it's not led by people with IDD, that would not meet the requirement. It's important that that training component is really created and delivered by people with disabilities to people with disabilities. And activities to support or expand participation in cross-disability coalitions, boards, and advisory panels. So those are the requirements. We report on those every year when we report to the feds, and we say how we've done that. And so that's what I want the committee to talk about. Like, do you want to make a project around that, or do you want to keep doing it through the staff work? And then that will help shape our next questions.
Thoughts or feedback to Emily?
Does this get does
Andrew,
this get rid of it? Would it be like the project that we design, or is it a different project altogether?
it would be up to this committee to design that project.
Like the project that I and Nadia talked about.
Yeah, that's different. Yep.
Okay, it's different.
But-
Okay.
So if you're talking about the Medicaid advocacy
Yeah.
project, if that project had like a training where people with IDD were training other people with IDD about Medicaid,
Okay.
it would
So
have
it's
meant that, but we didn't write it that way, so it doesn't meet it.
okay. So
Yeah.
it's a total different project.
Yep.
Okay.
Mhm.
Are we okay with what staff are doing now? Or do
Really-
we want to? I'm sorry. Ooh.
William has his hand up.
Oh, go ahead, William.
Hey, this is William. Hey, first time. Look at that. But also, I just wanted to say I don't know if I'm fully understanding, and I apologize, Emily. I know you explained it thoroughly. I will say, if my frame of reference is off, I really appreciate how we have the staff initiatives and the just the framework that you have set up for MODDC. I think you guys do a phenomenal job about having the open discussion and then the steps moving forward and just setting everything up and then moving forward on it as you do. And so if that's what you're
Yeah, so it's sort of what I'm referencing. So if you wanted to create a self-advocacy project, kind of like you did for the menopause project, then we would have to start talking about that as a committee. But if you want to leave it as we've been doing it, which is where staff create places for this to happen in the year, then we can also keep doing that. But I think it would be helpful to staff to know kind of which direction we're going, but also it will be helpful to you guys as you're prioritizing our funding, right? Because you're going to be spending our funding with projects in the future. And so if you want the self-advocacy project, you might have to make decisions about, are we going to fund the self-advocacy project or are we going to fund Blue Envelope project, right? At the end of the day, we'll have several on the shelf and you'll have to prioritize how those get disseminated.
Gotcha. Thank you so much for that.
Allie, I think I see a hand.
Is this like when Christina takes us to the Capitol? Is that what?
No, council members' advocacy does not count for the self-advocacy requirement. So no, it doesn't. Jordana has her hand up.
Oh, go ahead, Jordana.
Yeah, I was just going to say because there are so many requirements for this, and it is part of specifically of the act that's required for the funding. I feel like having it with the staff who really fully understand those requirements gives us the most flexibility to meet the requirements in a way that's meaningful to Missouri. Not that what the organization we were funding previously wasn't meaningful, but I mean, they're a pretty large statewide organization, and I don't know that establishing another statewide self-advocacy organization would be the best use of those funds. Like it seems like some of that smaller things that we can do, that the staff can do to really meet those needs and make sure that the requirements are met seems to be pretty impactful. Plus,
Thank
if
you,
we
Sabrina.
plus if we help establish another self-advocacy organization and we aren't able to fund them ongoing, then that just it leads to sustainability issues for them possibly.
Right. Okay, so I've heard people say they prefer the way that it's being done now, instead of making a new advocacy group or funding a new advocacy group. Am I hearing things correctly? Jordana gives a thumbs up.
You have head nods in the room.
Okay. So we don't have any changes to make. We're just gonna keep letting staff find ways to integrate the self-advocacy portion of the DD Act of what we need in the council.
That works. Thank you for the feedback.
All right. Thank you, Emily. All right. Next, we have the dental telehealth discussion. And Emily, do you want to give a little bit of background?
Yeah.
Or refresher? Sorry.
So in March, you guys heard a presentation from Missouri Coalition for Oral Health that was a summary of the project that they did for the council. That was a 3-year project. I can't remember exactly how much you guys awarded to it. They came and they gave kind of an end of project summary for you guys. You got some data on, the outputs of the project, and you heard some of the outcomes of the project. And they had also mentioned that there was more that they could do if they had additional funding. So what was sent to you were 2 proposals from the Missouri Coalition for Oral Health that would expand upon the teledentistry project you've already funded. So we are not under contract with them right now. That project is over. So if you were to move forward with funding more work towards oral health, this would be a sole source contract with Missouri Coalition for Oral Health. We would be able to justify that they were the single best option for to do this project in Missouri. And so you have 2 different options here. This one, sorry, let me fix some stuff on my screen. So this one is incorporating a private practice provider that includes training and equipment. And they would be asking for $150,000 the first year and $75,000 the second year to do that work. I'm going to switch to the second one. And the second one is about expanding, and they would be asking for, sorry, I can't quite click on that. I don't know. They would be asking for $100,000 the first year and $60,000 the second year to do that work. So similar to the other projects we've been talking about, if the committee wanted to use council funding to continue efforts on dental access, these projects might be a good place to look at, and then they would be put on the shelf until there was funding available, and the committee would decide, like, they would prioritize the spending. So this would just be one of several on the shelf.
Thank you, Emily. Thoughts? this something that we want to continue and expanding with?
Allie has her hand up.
Go ahead, Allie.
I think it's something we should continue. Continue with. I don't know which one.
But you think it's something that we should continue with?
Yes.
Thank you, Allie. I think it'd be something good to continue with too. I don't really have a preference on either one. Nadia or Jordana?
Yeah, this is Jordana. I agree that it's something that would be worth continuing with. I think my preference would be for this second model of expanding it kind of into the Southwest Missouri area centered around Springfield. Simply because Enable Dental already has the experience of running this type of program. So I think the initial lift is going to be lower as opposed to getting a private practice up and running with all of that and not knowing where a private practice that would be have the capacity and willingness to do this or how long that private practice will stay in existence.
Those are very good points, Jordana. Thank you.
Great points, Georgiana. I agree. This is Heather. Thanks.
And Heather, I apologize. I keep forgetting you're on here. So if you have any other feedback, it would be great to hear it. Emily, do you need a motion and a second for us to decide which one? Or just a proposal for one or the other?
So I guess from the committee, are you accepting the second proposal as presented? Hold on, I gotta fix my screen. That's the expansion for 100,000 in the first year and 60,000 in the second year. Is that where you're leaning?
I see Jordana gave a thumbs up. Nadia, Allie, are you guys okay with that? Nadia says yes. Ashley says yes.
So Madam Chair, this is Emily. I think what the committee would need to do is to make a motion to approve that proposal for future funding. Will it allow you some flexibility to prioritize projects? So it wouldn't make a commitment, towards any one specific funding year.
Okay.
Necessarily.
Okay.
Can I, this is Heather. Are we concerned about the funding stream not being available for them? I just want to make sure that I'm understanding correctly.
This is Emily. So we already have projects obligated under contract through 2028. So our first available funding would be 29 or 30.
But those revenues will be there at $160,000 over 2 years, correct?
Assuming we have level funding in 2028.
Okay. Awesome. Thank you. I just wanted to verify before I voted on it. I don't want to spend money we don't have. So thank you for clarifying.
Okay. Thank you for the clarifying questions. PDC committee members, can I get a motion to move forward with one or the other for future funding?
Madam Chair, I'll make a motion that we move forward with the second proposal as is for future funding.
Thank you, William. Can I get a second?
This is Heather and I second.
And Heather, I apologize, but I don't think you're more than welcome to listen to our committee, but I don't know if you're actually on the PDC, so I actually need a PDC committee member to second.
Second.
Is that Allie?
That was Allie.
Okay, thank you. So I have a first and a second. Roll call.
I show the motion to move forward with expanding teledentistry. Rachel,
Approve.
Allie. That's not here. Jordana.
Approve.
Lisa's not here. William.
Ap-
Nadia. Ashley.
Nadia.
Approve.
Andrea.
Approved.
Your motion passes.
Thank you. All right. Thank you, PDC. Okay. I think next on the agenda is just the approval of March's meeting minutes. Is that correct?
You have, yes, March meeting minutes and then any new business or future agenda topics.
Thank you. So can I get an approval for March's meeting minutes, please?
I make a motion to approve our meeting minutes.
Thank you, Allie. Can I get a second?
Second that.
Thank you, William. Can I get a roll call for approval?
For March meeting minutes, Rachel.
Abstain.
Allie. Jordana.
Approve.
William.
Proof.
Nadia. Ashley.
Approve.
Andrea.
Approved.
Motion passes.
Thank you. Okay, PDC, do we have any brainstorming ideas for future topics? None? Did we wear ourselves out providing future funding for other projects? Okay, if there are no other future topic options, is there anything else that we need to discuss? If not, I will take a motion to close PDC meeting. I knew you were going to do that, Allie. Can I get a second?
I second that.
Thank you, William. All right. Thank you, everybody.
Hello, everybody. Welcome to EOC. I have a couple reminders I would like to go over. First, if we can please raise your hand before speaking, and I will call on you to speak. And only the members of this committee can vote on things or share comments. So, thank you for that. Can we do a roll call, please?
Allie, my apologies. I don't have the attendance sheet up. Is there a staff member that would happen to have that handy in the room?
Yes,
Thank
yes,
you.
thank you.
Allie,
Yeah,
Lisa Nothouse, Rachel,
Here.
Connie, Tony,
Guilty. I mean, here. Thank you.
Ashley,
Here.
you have a quorum.
guilty. Okay, icebreaker question is summer or winter? Do you like summer or winter? I like summer because I can't put socks on. So, Rachel, summer or winter?
In between? No. If I really had to pick, I would probably pick summer.
Okay. We're still coming to
You know, I would pick summer. I hate ice. I hate walking on ice. I hate shoveling. Yeah, summer.
Okay. Ashley,
Definitely a summer.
okay, we all agree. That's a good
We all
thing.
agree on something. Look at that.
How did that happen?
You
Right.
know, Allie, everyone has a right to my own opinion, though, right?
Yeah, I hear you. Okay. Next, we have another interview to do. Catherine will help us.
Sure. Let me share my screen real quick. Okay. So before we get started, we do have 2 interviews scheduled for today. We have the first one scheduled for 2:00. That is Amy Hester, and I don't think that she will log in. We haven't been able to follow up and contact her with confirmation. The second interview will be Carrie Hammond. That will be at 2:20. And she was the person that we were supposed to interview last time. And we thought that she had no-showed, but that was not the case at all. She actually tried to reach us in advance using the general MODDC email, not contacting myself or Shannon directly. But she did try to reschedule in advance. And so she's rescheduled for today at 2:20. So I think what Allie wants to do is kind of go through our committee business, and then if Amy or Carrie log in, then we'll just go ahead and do those interviews. All right? Okay. Do you want to assign the duties of the committee?
Yes, I will do the welcome. And Dr. Tony, would you ask the questions?
Sure, be happy to. Thank you.
If you don't forget, Michelle will do the closing voice. That's okay.
Okay, so this is Catherine again, and Allie wanted me to kind of review the process and where we are in the application process, and then what our next steps are going to be. So I'm going to run through that. I wanted to review that we're only interviewing people from certain regions of the state, and one of the regions is the St. Louis region. And then the second region is the South Central region. This is this upper pink area. And then we're looking for people in this lower purple region. This is the Central region. And so those are the areas that we're focused on right now. So the next steps in the process is we're going to continue interviewing applicants. And then at the beginning of this process, you all really wanted to pick a couple of your favorites for each region of the state to make sure that we have plenty of people to recommend to the governor. And then once you pick your favorites, then those applicants will be referred to the governor's board and commissions, and we'll assist them with that second application process. And then the governor will ultimately decide who will be appointed to the committee. And we need to make those decisions by June. And I think we can meet this goal. We'll probably have to have another off meeting June to finish up the interviews and then decide who you all like. And then we're focusing on how we pick your favorites. You wanted to focus on how they answered the questions, if they answered them well, if you believe they have MODDC values, and do they meet our membership needs? So we're looking at the region of the state, whether they're a parent, guardian, or self-advocate. We're looking at diversity and the types of disabilities that are represented. Okay. So, do you want me to go by region or individual? Don't care. Okay. So, what I've done, what Allie wanted me to do was to kind of present each person that you have interviewed so far, because sometimes we haven't had a lot of time to discuss each applicant, how their interview went and what you thought. So I think we need 3 people from the St. Louis region. You've already interviewed 2. The first one here is April Nixon. And she's a parent of a child with a disability from the St. Louis County. She works for the St. Louis ARC, and she really talked about the importance of inclusion in her interview. And she came highly recommended by Lisa Liss and Sharon Spurlock. So do you want me to go on to the next St. Louis region person, or do you want to talk about April?
If anyone have anything they would like to share about her interview, what they thought. And she was the person who did not receive the questions ahead of time. But I still think she did a good job for not having the extra prep time. Any other opinions? Okay. Okay, Tony.
I felt like she was aligned with the values and the goals of MODDC, and I believe that she would probably be a really good fit in the role. Those would be my takeaways.
Okay, thank you. Anyone else?
We go on? Okay. The second person that you interviewed from St. Louis was McKeel Cross. He's a self-advocate from St. Louis County. He works in early childhood education. He served as the DRLD MC, and he's a current board member of the St. Louis ARC.
Any comments? Opinions? I like him. I thought he aligned with our values. I thought he was very personable. I liked him. Ready to go on.
Go on, okay. So I just wanted to comment. So April and McKeel were the 2 people that you interviewed from St. Louis. And I do think we need one more person. So if you all can be thinking about other people from St. Louis that you might want to interview in June, that would be most helpful, and refer them to our application form. Okay. Oh, Lisa?
I know we have a new rule, or what, it's Lisa, Liz. I know we have a new thing where people have to be recommended by someone on the council. Have you thrown that out to the full council or just EOC? And I'm only asking because maybe to get some more people.
Yeah. So at the beginning of the process, actually in the bylaws, it's the EOC's responsibility to do membership. And you all had decided several months back that it would be a referral-based process by the EOC committee, including the executive committee. And I think that was for historical purposes, that you wanted people on the council who you knew, like you knew well, that they would show up, that they would be engaged. If you know them, you know whether or not they have MODDC values, all of those things. And that's why the referral process was important to you all originally.
And just to follow up, I was just sort of asking if it made sense to broaden that since you don't have a big pool of people. Just to suggest, I don't know, because I feel like all of us have sort of talked to all the people that we are going to talk to or that we can think of. Do you know what I'm saying?
Yeah. Do you want me to talk? Or? Allie and I have talked about that a little bit, and what we did to make sure it was referral-based focused is we reviewed all of the previous applications that we've had in the past, and then people who met like the region requirements and stuff. Allie and I discussed those, and she decided who would be best to interview from that. She's also suggested that I get referrals from the partners class and Mark Satterwhite because of People First. She thought that would be a great source because he works with folks statewide. And so that way we're still doing a little bit more outreach, and we can still do a little bit more of that, but it's still more of a referral based process like you all originally wanted. It's just tweaked a little.
Thank you.
Okay, so the next region we're going to talk about is the South Central region. We need one person to sit in this position, and you've already interviewed 2 people, and you're going to interview another one today. So you have a total of possible 3 applicants for one seat. The first person you interviewed was Christian Powers. He's a self-advocate and a partners grad. He's from Franklin County, and he served on the Maine State DD Council for 10 years and actually served as the chairperson. And he worked on legislation to remove the R word from policies.
Any comments? I personally want this guy so much. I think he could teach. I think he could teach us and show us new things. So I think it would be exciting to have you. Dr. Tony.
You know, I thought that Christian presented well. He definitely had the experience. I think he'd be a good fit. Those are my takes on it. Yeah.
I agree.
Ashley.
Yes, I said I agree.
Yeah. Thank you.
Okay, the second person that interviewed from the South Central region was Amy Zenthifer. She's a parent of a child with a disability, actually two. She has a 9-year-old daughter and a 12-year-old son with developmental disabilities. She's also from Franklin County. She's currently serving on the DMH Quality Advisory Council. Sometimes we call that council the quack. And she was shared with us that she had been involved in a Penn State leadership course, and she was excited to maybe use what she learned if she were to serve on the council. The quack, is that right? Yeah, the quack. Quality Advisory Council.
I like to like that huge. And I enjoyed what we believe. So seems that she was making decision. Making good decision.
Next, okay. Moving on, this is the third person that would represent the South Central region. We hope to interview Carrie this afternoon. Carrie Hammond is a parent guardian of her son. She lives in Osage County, and she has advocacy interests in education and guardianship, and she has experience with the awareness of services and strategic planning in her work. And she wanted to mention that this is her photo, but she recently got a haircut, so she's going to look a little different when she shows up this afternoon. Yeah, state parks, not that I'm aware of. Okay. And then moving on to the next region is the Central region. We have not interviewed anyone from that region yet. I do think that we'll be able to make some connection with people first to find more people. We did offer an interview to Amy Hester today, but she did not confirm. So I'll continue to try to follow up with her. We tried contacting through email and phone calls as well. Amy is a guardian of her adult sister, and she lives in Boone County, and she works at a provider agency, ACT, in Columbia, and she has personal experience with the Medicaid waiver system. Those were things that I pulled from her application. So basically, we need to get more recommendations if you think of anyone or anyone that Allie and I might be able to reach out to. We need to really focus on the Central region. We need one person to serve from that region. So we'll continue to reach out to Amy. And then we'll just continue to interview.
Sorry, I'm not even on this committee, but two things. I wanted to let you guys know that I did reach out to Leanne because I figured she would know a lot of people in Columbia. And I can follow back up with her to see if she had any recommendations of people. And also, is anybody besides me concerned with the fact that we're not interviewing anyone with an intellectual disability? since people with intellectual and developmental disabilities are our stakeholders. And I'm not saying that some of these parents, that's not their child's diagnosis, but I think we don't have much representation on the council now. That a lot of we just lost, 3 or 4 people. So I don't know. I feel like that's a big miss that we should keep looking for. I don't know what the answer is. I've been looking. I haven't found anybody. It's hard to get people to commit. I think the having the PA covered is an issue. Some of those things are the answers that I've gotten from the people that I've reached out to. But maybe Hannah Satterwhite's dad might know someone because he's got a lot of, connections too. So sorry, those were my 2 cents.
Tony. Tony.
My question, we were talking about in June, we're going to present to the governor. Are we talking about the end of June, mid-June? What part of June are we targeting for our deadline here?
This is Catherine, and I'm thinking the end of June because we need to find people to interview and then schedule, make sure that everybody can attend or as many can attend as possible. Did you have a question, Emily? Okay. I will say, can I comment on what Lisa said? Okay. I just wanted to speak to what Lisa said. I think that is important that we have a good diversity of disability represented. And we did have, I think, 2 people, one of which from the central region, that were suggested, but they weren't interested. So I think it's just a matter of finding just the right person who's interested.
What she just said. Coaching of what the council is, Allie.
Can Daniel talk?
Can I speak to what Lisa said?
Yeah.
So coaching what the council really is, I in a CDD's Facebook page, they just put out a really good information. I don't know if that's something the EOC could pick up and share with those applicants exactly what the DD Council is and what we actually do. Very good information to share with the applicants, I think.
Thank you. Okay, we have Carrie Hammond.
Oh, Carrie's here? Oh, thank you. Thank you. Okay, so our interviewee, Carrie Hammond, is here, and so I'm going to hand it.
Carrie.
Hey, Carrie, are you with us? Are you here? Can you hear us, Carrie?
Yes, sorry, just trying to find all my buttons.
Oh, okay.
Hi, Carrie. I am Ali Frederick. I am chair-elect of the council.
Nice to meet you.
Nice to meet you. Thank you for taking time to be here with us for this interview. I would like to introduce you to Dr. Tony Taylor. he will be asking you your questions.
Good afternoon, Carrie. How are you?
I'm great. How are you?
Doing great, but I'll get over it. No. So, hopefully you got the interview form with the questions ahead of time.
Yes.
So if that's the case, these shouldn't be a surprise. And the idea is not to stump you, but to just kind of get some details around some areas that are important to the council. So if you're ready, we'll just go ahead and dive in.
Yeah, absolutely.
So, okay, first of all, think about the work that MODDC does and tell us about your favorite project or activity the council does and why that's your favorite.
And there's so many great things that you guys are involved in, but I have probably two, and I don't know that I could really figure one is more, I figure is more substantial than the other to me. The support for MOABLE, I think that's really incredible. And even from a personal standpoint, I know that, I provide for my son on a daily basis, but to know that if something were to happen to me, that he would have a little bit of cushion is really incredible. And I know that for the whole community, that is very important to have that independence and have that kind of backup to take care of everyone. And my other one is probably the Disability Rights Advocacy Day. I work in the Capitol a lot of days, not every day, but I've seen that firsthand a lot of times, and I find it to be incredibly inspiring. And I believe we all have to be our own advocates as much as possible. And being able to see that firsthand is really empowering.
Okay. Second, tell us about a time you're proud of your advocacy work. What did you do? Who did you work with? And what happened?
Sure, absolutely. It's not really any big things, but it's a lot of small things that I have done, mostly through my work. The last 2 years, I've kind of taken a step back because my mother was ill and then she passed away. But before that, I changed our tour desk at the Capitol to have an ADA acceptable area where there was one before, but it was covered by the register was in the place there. And so there was no really good place for us to be able to communicate. And I wanted to change that. So we fixed that. It is now ADA compliant and is much better than it was before. I have built and put together visitor sensory kits for people that come to visit the Capitol and our museum. I signed my staff up to go through autism friendly business training, and we've maintained that for the last about 5 years. And I actually won an award from State Parks Masterpiece Program for that because they thought that was a wonderful idea. So I've really encouraged a lot of our other historic sites and state parks to join in on that and become certified in that. I think that's really important. I've taken several specialized training in inclusion and diversity, mainly through the American Association for State and Local History. They're all museum focused on how to benefit visitors that come in and how we can better engage with them. I kind of ended up being the go-to instructor, trainer, lecturer for Missouri State Parks for inclusion and diversity. So I a lot of times will do that kind of training for our temporary seasonal employees that come into state parks during the summer. I've also given a lot of that training to the full-time staff, permanent staff, and winter workshops and things like that for state parks. So I've kind of spread it out, over several things throughout the whole department because, it's so important to me. And I feel like, we really need to expand on that in the work that we do every day. I'm kind of working with some things with our museum curator right now. We're thinking about what we can do with the exhibits in the museum to make them more visitor friendly, more texturally interesting, a lot of hands-on things that people can touch and have a better experience within the museum because we have a lot of people with low vision or vision impairment that come into the museum. and there's not a lot that we have to offer right now. So we're trying really hard to change that.
So tell us your thoughts about sheltered workshops and segregated state schools.
Sure. Sheltered workshops, I think they're really important. They give, the participants a sense of pride and accomplishment, be able to give them, that job to do with the assistants. Of course, I would love for them to be paid a lot more. We had unlimited funds in the state. That would be fantastic. But I do think it helps them grow and is very beneficial for them. As far as the segregated state schools, I know maybe at one time the intent may have been good and the thought behind it may have been positive, but I don't think it really turned out that way. I know that I feel like it kind of does a disservice to the students. I know it needs specialized training. A lot of teachers that we have in our public schools do not have that kind of training. But, I feel like we all live in this world together and we should be together all the time. And I feel like the more that we can do in typical classrooms instead of in a segregated school, I think is positive.
What do you think is the biggest issue or barrier for Missourians with disabilities, and why?
Probably systemic ableism. Things have been so ingrained in society as a whole, and we've come a long way, but I feel like we have a long way to go. We need to make things as mainstream as possible. Like I said before, we all live in this world together. We need to work together, and we need to experience life together. And changing minds is not always easy, but I feel like we'll get there.
Will you support working together without taking sides? For example, Democrat, Republican, etc., by using a plan that includes people from both groups?
Yeah, absolutely. My day-to-day work, we are a nonpartisan entity, and being that our museum is located in the Capitol, we deal with all kinds of visitors that come in from all different spectrums, and we're there to service the public regardless of who they are and what they believe.
Okay. Can you commit to the council schedule in committee work?
Yeah, I don't see any problem with that. I make the schedule for our staff, so I can pretty much work around anything that needs to be done. The only problem I see with that is if I was, in the hospital and not able to get to a device or something. That would be the only issue I would ever have.
Okay. Any questions for any of us?
I just had a couple of general questions. I see that the term is 2 years, 3 years, or 6 years. Now, who determines that?
This is Catherine, and the governor appoints people to serve on the council. And so you can serve up to 2 3-year terms. And so I think it's just a matter of after your first term, if you're reappointed to serve for that second term for a total of 6 years. Yep.
That makes perfect sense. Okay. All right. And as far as the full council meetings, how far in advance are those scheduled? Are those scheduled a year in advance or by month, every other month?
Yeah, the schedule goes on out. It's always on the odd months, and committee meetings are held on the day before the full council meetings. And generally, I want to say it's the third Thursday. Is that right, everyone? Generally. I know this month was different, but generally it's the third Thursday of the month, Thursday and Friday. So
okay, so it's always mostly a set.
It will be set.
Okay.
Yeah.
Okay, fantastic. I think that's the only questions that I had.
Okay. Allie, I'll turn it back over to you.
Okay, Carrie, thank you so much for coming in. It's me, right? Yeah. Okay. It's Lisa Liss.
To meet you.
Our questions today. Tony already asked you if you had any questions for us because he isn't following the script. I'm just teasing. So the timeline is we are interviewing people between now and the end of May. We're hoping to decide who we will recommend to the governor's office in June. If you're selected, we will let you know what the next step will be. And you would need to apply using the governor's board and commission application, which we will help you with if you're chosen as someone we're going to put forward. And then it's the governor who makes the final decision.
Okay.
So we really appreciate your time.
All right. Sounds great. Thank you so much. I appreciate you guys.
Thank you.
Thank you.
Do we have any opinion or comments about her? Not sure that what is it? I just wasn't sure that she aligned with all our values that we look for. Anyway, this is just
Oh my gosh. I would agree with that. I loved the work that she's done at the Capitol. I think all of that is awesome. I was concerned, of course, with some of the questions about inclusive environments. I did love her answer about systemic ableism, though, but that's kind of a big, let's fix it. How are we going to fix it? So.
Tony's got his hand up.
Tony Taylor.
You know, if we're looking for one person from the South Central region, personally, I would put Christian Powers at the top of my list. And second would be Amy, and third would be Carrie, just based on the quality of the responses to the questions.
Yeah, I wouldn't even add Carrie. I would just leave it at Christian.
Do you guys want to vote on anybody or group, or do you want to wait till you interview everybody? Do what? It's up to you and the committee.
Okay, so committee, do we want to vote now on what we have, or do we want to wait till we interview everyone and then take a vote at a non off month meeting. Tony.
I personally, I think it's a little premature to vote on anything, not knowing if or who or what we'll get for the remaining areas. For example, we only have 2 candidates for the St. Louis region thus far. We're pending a third. We have 3 possible candidates for South Central where we're looking for 1. And I don't know if we're going to close any interest to that because we have 3 or, and same thing with the Central region. We're looking for 1 candidate and Amy Hester has not presented herself to an interview yet. So not knowing if or who or when we'll have, I would think that the vote should come once we're closing interviews and we have all candidates considered. Does anyone else have any other thoughts around that? But that would be my take on it. I think we're just a little too soon to vote.
Rachel.
Yeah, thanks, Allie. I was going to agree with what Tony said. Part of me was wanting to kind of get some of the voting done now, but I don't want to go in too prematurely and say yes to someone and have another interview and say, oh, this person presented better, or this person, I don't want to say better, but you know what I'm trying to say, had a better understanding of what the council does or what we do and could provide us and better help move the council along, moving forward with what the council wants to do.
Okay. That sounds good. So we will have to have off month meeting to do more interviews and votes. Catherine will help get that. Emily.
This is not related to voting, but you have a non-committee member comment in the chat. Do you want me to read it? You read it. Okay.
Okay. We'll move on. We'll move on to our discussion about getting a non-profit member on the board.
So this is Catherine again, and if you remember at our last full council meeting, Emily did a training about agency representation. We talked a lot about agency reps during that meeting, and during that training, we learned that we have a requirement for membership that we have a non-governmental organization or an NGO serve as part of the council. And because EOC is responsible for membership, that's what we're talking about today. And Allie was thinking that she was wanting the committee to brainstorm ideas of what a good NGO would be to serve on the council. So I sent some of this information out in advance. An NGO is a nonprofit organization. It's a citizen-based group that operates without government control, and it's a non-religious and non-military organization. And we kind of made up this brainstorming list. Emily provided some information, and then Allie and I talked about it, trying to think about what would be a good organization to serve on the council that would help us meet our strategic plan goals, like really think about an organization that might help us learn and meet our future goals. And so this is just a list of brainstorm organizations. You don't have to pick these. It just kind of helps us get us thinking about it. And then I listed those ideas and then I translated their mission statements into plain language. So you kind of have an idea of who they are along with the link to the organization. So we were thinking that we have a lot of work that we want to do around health. And so we suggested the Missouri Foundation for Health or the Missouri Rural Health Association. I know that rural work is really important to a lot of council members. We thought it would be good to have a transportation organization, but we really couldn't think of one. And maybe you all have one in mind. Also a legal organization. It seems like we have a lot of legal issues happening lately, and that would be nice to have an organization that could help us in our work. We talked about the Missouri Budget Project because it seems like the budget is always something we're talking about. We talked about the Starkloff Disability Institute. That would be a good cross-disability advocacy group to consider. We talked about Missouri Disability Empowerment, or MODD. We don't have a lot of representation of people who have young children with disabilities and educational issues, so that might be one to consider. The ACLU is a legal organization that might be helpful. And then also, we talked about NAMI, or the National Alliance on Mental Illness. We don't have a lot of knowledge base on mental illness and how that impacts developmental disabilities. So those are just some examples that we came up with. And I think Allie was wanting to just open the floor for brainstorming on that. Maybe think of a couple that you could recommend to Emily for consideration for membership.
Or even what category you think would be most helpful. Rachel, thank you.
Yeah, Allie, I think these are all great suggestions. As Catherine was going through the list, I could think of people that I knew at each of the organizations that I could recommend. But because I've been on the council for so long and with my professional work and just as a self-advocate as well, over the years we have talked about transportation and trying to make it better for the state of Missouri for people with disabilities. So I think it would be a good idea if we could find someone in that realm to be on the council and to represent and to make that connection and to help us maybe further the goal of getting transportation improved.
Okay. Do you have any organization?
I was gonna say I know a couple. I mean, we all know Oats. I can't personally say I know anybody over at Oats right now that I would recommend, but there's also a new transportation called organization. It's called New Growth, and they do kind of door to door transportation, but they what's the word I'm looking for? They do kind of like case management transportation where they call in and they put in the orders for someone to get picked up and things like that. But they're based out of, I think, the southwestern area. I'll have to look, but I don't remember for sure. But they're a newer transportation organization.
Okay. We will try to look into that.
And I'd be happy to send more information to Emily or whoever and recommendations if I can think of anybody. So.
Thank you, Rachel. Anyone else? No. You want to pick two or three of these to have everybody look at? Or somebody has an opinion. You trust me to do this. Okay, I guess Catherine and I will make this decision.
Yeah, that's uncomfortable. Allie was saying that she and I will just decide.
Madam Chair, so we have transportation as a subject that the committee's interested in. So is the plan for me to identify 2 or 3 transportation options and bring that back to EOC, and then you guys can narrow it down to the final recommendation?
Okay.
I'm just asking, process-wise, is that kind of the plan?
Okay. Dr. Tony.
You know, that's kind of where I was headed. Actually, I did AI search for Missouri statewide disability transportation, and I don't know which of these are nonprofits, but maybe some additional digging to see what is statewide so we can represent not only Kansas City, St. Louis, Columbia, and Springfield, but definitely to pull in the rural areas where I know transportation is probably a larger need than even in the highly populated areas. I mean, I think it's a need across the state, but we definitely don't want to ignore the rural population and want to include, so if that's the direction we want to go, which I think is a great idea that Rachel brought up to have that type of voice on the council, that there might be more than just the 2 or 3 we've mentioned if we want to maybe take a little bit of digging time to see what might be possible.
Thank you. Yeah. That's what we'll do. Figure that out. Okay, thank you. Do we have any new business? Okay. 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 Do we want to approve the minutes from March? You need a motion. Oh, sorry. We need, we need to make a motion for January. Yeah, we did.
I'll go ahead and make a motion to approve the January meeting minutes.
Hey, this is Rachel. I'll second.
Thank you. Roll call, Shannon, please.
Allie,
From
Lisa's not here. Rachel,
Approve.
Connie's not here. Tony,
Approve.
Ashley,
Approved.
motion's passed.
Thank you. You have it. We need a motion to approve March minutes.
I'll make a motion to approve the March meeting minutes.
Thank you. Second.
I can make the second.
Thank you.
Sorry, it's a black screen, but I guess my iPad doesn't have my picture, Allie.
She said, sorry, she has a black screen, but her iPad's not working today, Allie.
Yeah.
Allie,
Approve.
Rachel,
Abstain.
Tony,
Approve.
Ashley,
Approved.
motion passes.
Thank you, Shannon. Do we have any future business? I think we need a motion to adjourn to early.
This is Rachel. I'll adjourn. I'll make the motion to adjourn early.
Thank you. Thank you, guys.
Thank you.
Thank you.
We now we're being recorded. We're still a couple minutes early. I was hoping to ask a personal question of everyone, but now I'm on recording. So my best friends have chickens. That'd be awesome. Okay. All right. We are close enough to 3:30. Let's go ahead and call this meeting to order. Shannon or someone that can be my rock star superhero, since I dropped the ball and I don't have the attendance sheet. And so can someone please take the roll call in my lack, please?
This is Shannon.
Thank
Tony.
you. Yes. Yes.
Are you
Oh,
present?
here. Yeah. Present.
Animesh, Heather, Jelani, Lisa Crandall,
Hi, I'm here.
Rachel,
Here.
Scott,
Here.
Leandra, Nadia, Kim, and That was Leandra.
And Nadia is present on chat.
And I think Leandra just came in, so you do have a quorum.
Super. Wonderful. Thank you so much. So with that, we will go ahead and proceed to, actually that's further down for the minutes. Never mind. We'll actually follow the agenda. So thank you. Now that we have the roll call. If anyone has been out to the MODDC members area, that's where all of our documentation is located. Hopefully everyone had a chance to review all of that. But if you need your own copy or would like to pull that up, the next document we will go over is called Budget Process in MO Plain Language. And so that is posted out to the MODDC members only area. So this is something we were hoping to get to last meeting, which was 2 months ago in March. And we had such a great conversation with our visitors along with the Olmsted Committee when we partnered. I can't believe that was just 2 months ago. That seems like a year ago. But anyway, we went through that in its entirety, and unfortunately, we had to punt this budget conversation. But Christine, if you could so kindly go ahead and lead us through the presentation on the budget, we would really appreciate that. Thank you.
Sure, happy to. And I will add, Rachel, this one's for you. I'm glad you're here today because we were going to do it when you weren't here, and you were the one who gave us the idea. So I don't know, I'm getting feedback. Is that any better? No. Okay. All right. So Rachel gave us this great idea of talking about how the Missouri state budget is made, because so much of our advocacy, particularly around Medicaid and protecting services, is dealt with through the state budget. So how do we fund and pass state budgets each year? So where does the budget money come from? The state gets money from your taxes. So this is money called general revenue. So as much as taxes can be painful, they actually provide your services to you. The state also gets a lot of money from the federal government. So Washington, D.C. and the state of Missouri partner to fund things like Medicaid. For Medicaid services like waivers, like the DD waivers, the federal government gives Missouri about 60% of that budget, and the state gives about 40%. Your income tax makes up about 60% of the state's general revenue. And you may have heard in the news that the governor is currently pursuing an agenda and the legislature, to eliminate the income tax. So that may end up on your ballot. It will be on your ballot in August or November. And it's important to know that that could affect 60% of the funds that we have for services and other things that the state needs to pay for. Some facts about the Missouri state budget. It's made through a set of bills that the legislature votes on. And actually just last week, the legislature on both sides, the House and the Senate, truly agreed and finally passed all their budget bills. A bill is an idea for a law. It is called a bill until it is passed and signed into law. So when legislators propose legislation, they're carrying a bill until it's signed by the governor and signed into law. The state constitution says the only bills that must become law during any legislative session are the budget bills. So the legislature could literally pass nothing else but the budget bills, and that would be okay under the Constitution. But they're supposed to always pass the budget bills so that the state has money to function. And that's always by the second to last Friday of session. So that's why they got it done last week, because tomorrow is the last Friday of session. Making the budget is a year-round process, and the House and Senate has to agree on the final budget and pass it no later, like I said, than the Friday before the last Friday of legislative session. So tomorrow's the last day. So they passed it Wednesday, actually, I think. But yeah, they passed it. They had to pass it by last Friday. So the way the budget works with the governor has a lot of influence over this process, even though he's not a legislator. So his budget is his big suggestion to lawmakers about what he wants. So he makes a proposal in January saying to the legislature, here's what I want to see in all these budget bills that fund the state services and other things. It could include education, healthcare, all sorts of things. He shares it during his State of the State speech, which he delivers in January. It's usually mid-ish January that he delivers that, and you can watch it online. And that same day, he or his staff release his suggested budget bills. The bills are only bills in Missouri that the governor can change. They're the only bills that the governor can change line by line. So he puts out his suggested budget, right? But it's not even technically a bill at that point. And then the legislature turns them into bills. But when the legislature is done with all their work and passing the budget like they did last week, then the governor has the ability with these budget bills to go in and add money or remove money to any line he wishes. There are no other bills in the state of Missouri where the governor has that power. He can either veto or sign something into law or pocket veto, but he cannot go line by line except in the budget. He has to sign the budget into law by June 30th, which is the end of the fiscal year. So the state runs on a fiscal year budget, meaning July 1 to June 30. So the state, in order to function, needs to have that money ready to roll by June 30th or by July 1 so that they can continue on. Okay, this is going to get a little dense with imagery, but shout out to Emily because she's a genius at stuff like this. So hopefully this makes sense. So we'll go slow, but it is going to get to be very full by the time we're done here. So in the center pink circle, it says state budget. Governor must sign these bills by June 30th. And he basically has from the time the legislature sends the bills to him, which is usually right after session. They technically haven't sent the bills to him yet. From last week until June 30th to sign them or line item veto, like we were saying. After that, the departments start getting together and start putting together their ideas for what they need funded for the next year. I'm not in a department in the sense that I know exactly how all that goes, but I will say they have time to start planning and thinking about, okay, what was funded last year? What wasn't? What do we want to try to go for last year or next year? The governor looks at the department requests and then has his own, interactions with them because all of the state departments report to him, right? So he's their boss. And so then he decides based on what they've given, what he'll keep in, what he will not keep in, et cetera, and puts together his proposed budget, which again is not technically a bill. It's just his big suggestion. From there, if you look at the yellow circles, so the governor puts out his proposed budget, and then the House starts meeting, the budget subcommittees in the House start meeting. So these are your state representatives, and they start hashing out where they agree with the governor, where they might disagree. They have public hearings where people can show up and testify. We were very engaged at this point because this year the governor had proposed a significant cut to DD rates for personal assistance providers in the self-directed supports program and day program. So anyway, the House is meeting through all of this, hashing it out, coming up with their budget bills. And then once the subcommittees come up with their plan, it goes to the full budget committee, which is like 30-ish legislators. It's the biggest committee in the House. And they can make changes from there. The chair of the budget committee is very powerful. So even if the subcommittee makes some strong suggestions to him, he or she, it's never been a she, that's why I said he, but he doesn't have to take them necessarily. So the full budget committee meets, makes changes, and then it goes to the House floor, and people can debate on the floor and all of that. But once the House passes their budget bills, all of them, including the ones that fund Medicaid, then it goes over to the Senate. So if you keep going with these yellow circles, again, I know this is going to get a little dense, but the Senate has a very similar process. So they have their fancy term for budget over there is just appropriations. It means budget. It's the same thing. I don't know why. They just like to be fancy. But they typically have about March and April, and I'm saying ish because it really depends on how fast the House goes and all of that good stuff. But they start working on the bills as well, and they come up with their own ideas. A big difference with the Senate, though, is that they can add more money to the proposed budget. So in the House, they have to work within the confines of the amount of money that the governor has proposed. So they can propose less, but they can't go above. In the Senate, they can add more money. So it does often look a little different in the Senate. Once the Senate Appropriations Committee has their hearings and hashes it out, it goes to their Senate floor for debate and vote. And that's usually where we're getting into late April, early May, coming up on that deadline to pass the budget bills. And then these last two go to, well, the next yellow circle says conference committee. And typically, always, there's a difference between the House budget bills and the Senate budget bills. And so when there's a difference, they have to come together to discuss those bills and to come to an agreement on where they disagree. So they go line by line on the items that they did differently in both of their bills. So this happened a couple weeks ago, this session. They have to come to an agreement because then it has to go back to both chambers to be passed again. The conference committee has senators on it and it has representatives on it. And it's represented by both parties. And it's a pretty quick process in a sense, but they're cruising through it, making sure that they come to agreement. Once they do, the final vote is on the House and Senate side. And the bill had to be passed by May 8th this year. And I will warn you, I wrote this presentation in March. So some of these things are a little outdated, but it's true, it was passed. And then it goes back to the governor to decide whether he signs or line item vetoes. I know that's a lot. I also am seeing some chats. I hope I'm not missing anything. It's just hard for me to see. So if anyone catches something in the chat, please stop me. Okay, so like this one is a little outdated. It says it's the end of March. No, it isn't, Christina. Updates on this year's budget process. So I've spilled the beans here. We passed the budget bills last week. So that's where we are and where we should be according to the Constitution. Initially in Governor Kehoe's plan for the state budget and his strong suggestion in January, he cut about $80 million to Medicaid waiver services for people with developmental disabilities. And we had talked about this. We were concerned about this. We did a lot of work around this, as you all know, especially because our legislative priorities were to protect Medicaid and home and community-based services. So he initially offered up 4 cuts to the self-directed supports program and 1 cut to providers for their day program rates. And I'll give you an update here shortly. But the good news is, and this is again a little outdated, but families and self-advocates and some of you spoke up after the budget, but governor's budget came out. And because of all that, the House Budget Subcommittee recommended they reverse the governor's cuts. And actually that has stayed true through the Senate as well, thankfully. So no matter where we are in the year, there are many chances to speak up about the budget. So I bring this up because I think sometimes we think about we can only have an impact from January to May when the legislators are there, but actually we could start talking to the governor in June before he line item vetoes or does anything to the budget. We could talk to the departments from July to November, December to weigh in on those, all of that good stuff. So there's a lot of opportunities to get involved. And I said, writing this in late February, hoping I have more good news. I do, but I'm going to save that for a second. But before we go into all of that, Tony, I don't know if you want to take it away from here, but we're open to questions. I know that's a lot of information, but you do have these slides in members only, and we can always sit down and unpack them further.
Let's give everyone a moment here to come up with any questions. Anyone?
This is Steve. I wonder about the income tax that people will get when they're fill their tax returns. Does it mean they're going to cut the tax return off those people who deserve it?
Steve, so you're asking, oh, sorry, Mr. Chair, may I clarify? Is that okay?
Absolutely. Yeah, go ahead.
Steve, you're asking if they cut income tax. Is that what you're asking?
Yeah.
Okay. If they cut income tax, what happens to make up that money?
Well, at Saxon, where I live at, I've seen people homeless, got their house burnt down. They have nothing to do, nothing with got signs on that they're trying to get people to help them by to get their money or food for them because there's a homeless guy that walks around, he collects cans and stuff like that, and I feel bad for him, but I don't know if he has a job or not. But it's people who has old houses that's not in a good shape, and they still live in it anyway. But when you come up to plan to talk to the governor or the legislators saying that they need a bill to send something for the people who can't afford for food, medicine, and stuff like that. Because it's sad that the American people is, just, I hate to see that. I feel bad for those people, who lost their family and don't know where to go and stuff like that. They need to stop cutting Medicaid too, because Medicaid, because I take Medicaid. I take Medicare, I take Medicaid. So I work in the kitchen, Sison, and I make a lot of money, but they cut my food stamps down to $40. It was like $200 something, but they cut it down to $40 because I was making too much money. But I understand that part, but I hope to God they don't cut down the Medicaid. Because a lot of people are depending on Medicaid for food and stuff like that, to pay bills for it. Because, that bills that people had to pay for it would cost a lot of money to help them get medicine and stuff like that. Because there's a lot of people that can't afford medicine or SSI or food and stuff like that, because it's sad. So I hope they change their mind, but right now it doesn't look like they're going to.
Scott?
This is kind of on topic, but off topic. This has been bugging me for quite some time. Yes, Christina, you said other than DRLD, we could advocate. But at the same time, one thing that has bugged me for a while about DRLD is other populations, such as whether it be voting rights, women's rights, LGBTQ, they get a week, 2 weeks. We only get 1 day. Why is that? 1 day, other than that has always puzzled me. Sorry to get off topic, but again, that's on topic, but off topic.
Yeah, I don't know really, 1 day. I guess the other side of the coin is that 1 day is greater than 0 day. That's another way to look at that, is that we do have the acknowledgement and the opportunity to come together and to have an influence. And I know Christina and team, I don't know if you were there for DRLD or not, but it was a fantastic event. And It really did. It was impossible to ignore the hundreds and hundreds of people all over the Capitol. I know that.
I'm
So
sorry, I wasn't trying to put that down. I was
no, I
just
understand. No, I
making.
understand. It wasn't interpreted that way. I don't know. Is there anyone else on the call that could answer to that specifically? Lisa Crandall, I see your hand. Go ahead.
Well, I wish I could give an answer. It sparked a question for me though. Who determines who has how many days or a week? Like how is that determined? And,
That's a great question. That's a great question. I really don't know. Does anyone have an answer to that? Emily, I see your hand.
Yeah. Thanks, Tony. I don't have an answer to like who decides one advocacy day versus a week. I know that we usually get a proclamation for the whole month of March, and then the council puts funding behind the DRLD advocacy day. Some other councils have other advocacy days that aren't as big, right? That still drives people to the Capitol for a specific person throughout session. So it's really, if you're Scott, if you're talking about it from like a council engagement piece, it's really the leadership of the council driving how many days we do that and the funding behind it.
And I'm really not certain who Titanic is on the chat, but Titanic puts that sounds like we need to set up more days. LGBT organizations probably lobbied for 2 weeks of advocacy. Disability advocates need to do the same. So does anyone know who Titanic is?
That's Nadia.
Okay. Thank you, Nadia. Appreciate that. Oh, she just answered. Thank you, Nadia. Okay.
Mr. Chair, can I share something as well?
Absolutely. Please.
This is Christina. So there are other advocacy days. We just don't lead them all too. So the CILs, the Centers for Independent Living, have their own day. Providers have their own days. But in addition to these big days, I would say the smaller days are often just as important. So some of you on this call have come with me to the Capitol multiple times, both in Jeff City and in DC. And that's where we can really sit down and make appointments with legislators and have important conversations, which is not to say that DRLD is not important. It's very important. But I also think there's a variety of approaches to advocacy, and it's not always about big splashy events. But, there, like Emily said, there are councils that do multiple day events. And so that is something we could consider if the funding was there.
Sure. So I see the heart. Any other hands? Any other questions? Anyone? So related to Steve's question about tax, has there been any specifics regarding making up for the 60% cut if that tax is going away? Has anyone heard any additional opportunity to be able to fill that void? Yeah, go ahead, Christina, you're on mute.
So the challenge will be that because income tax makes up 60% of our state budget, we're going to have to make up the money somewhere to maintain services, or at least to have some services. And I'm not just speaking about disability services. I mean, maintaining your roads and funding education and all that good stuff. So the way the ballot language is written that you'll see in August or November, again, it's very important that you turn out to vote on this issue, whatever you decide. It's very open-ended. So it says, the income tax will be phased out over, I think now it's 5 years. It's changed a couple of times, but once it's phased out, the legislature will have a right to increase sales taxes, basically however they see fit. And that could include services. Some of the current talking points are that services are luxuries that only rich people purchase. And so they'll take the brunt of it. But we've been explaining to people that often people with disabilities have to pay for services because they may need support to do something. So it's not always a luxury. And so All this to say, it's very unclear. And I think a lot of people who are sort of on the fence about whether to phase out income tax are concerned that there's no clear plan if we eliminate 60% of the budget, how we make that up, if that makes sense. We had to testify for information and just tried to bring the disability lens to it, but it was a very, the last one was a pretty heated hearing with a lot of people on both sides saying, you know, why this is great for Missouri or it's terrible for Missouri.
Okay. Thank you. Anyone else on the topic of the budget?
Yeah, this Steve.
Go ahead, Steve.
The budget that the congressman and the legislators and all the people in the House and even Washington D.C., the president in the United States, the president always listens to what the legislature says or the senators and the Republicans and stuff like that know about the budget. They need to make a budget where they're cutting Medicaid for people who have health problems. Like I got cancer in my prostate and I'm diabetic type 2 and my blood sugar is going high and low. But they only need to cut Medicaid because I need that. Everybody who has health problems and stuff like that and are sick and they can't help and then they have no money to pay for the doctor's bill and stuff like that. No, that they need to make a budget where they'll help the homeless and help the people who are sick and can't afford to live in the house and they have to live out on the streets. But that's terrible because the budget what they need to do with the budget is talk to whoever they need to talk to and they need to change their minds about cutting the budget for Medicaid. And the budget that we need to do for the people is to I don't know why whoever thought about cutting the budget for people who got Medicaid. And I do. I really need Medicaid. And if they cut it, then I probably won't be paying too much have trouble paying bills and stuff like that, you know. But if you talk to the governor or the legislators or Republicans and Democrats and stuff like that, all about that, maybe we'll come with a good results that will change their minds and not do cut the budget and stuff like that, you know. So I guess that's all I gotta say.
Well, thank you, Steve, for sharing. I appreciate that. And it does create a lot of conflict, turmoil, struggle for a lot of folks. I do want to catch up with some of the chat messages as well. Nadia put in here regarding having one or multiple days for disability. She put that it's just that transportation is such an issue that a single day per year is not ideal. And that's probably the case for travel and transportation arrangements, and it's probably not ideal. So thank you for sharing that, Nadia. She also, regarding this topic, put in here, it's designed to screw us over. They want to cut our services. We will see a crisis as then death of many services over the next decade if this passes, which means death of many people. They'll pull money out of Medicaid and education, et cetera, for road maintenance and public safety and stuff, and they'll call it efficiency. Tax cuts are the topic. So thank you, Nadia, for sharing your thoughts. Does anyone else have any additional thoughts before we move on in the agenda? These are some great feedback and input, great thoughts here.
Just one more.
Okay.
And I am looking at you. I have two screens. I have noticed that one issue among family and friends and me is how some some people can get cut and other people don't. And the ones that don't, or the ones that do, are saying they make too much. And the ones that don't make more than the people who get cut. So that is just where I'm like, how? That's the puzzle. That's a mind blower for me.
Okay. All right. Anyone else going once, going twice? Okay. We're going to move on now to the next topic, which is the end of legislative session updates. So there is a document in members only. It's actually labeled end of legislative session updates.pdf. And so following that, the current session does end tomorrow on May 15th. And all the latest information is in the document. And as Christina mentioned, all of the budget bills passed as of last Friday. If there's anything else known before July, Christina and or I will make sure that we pass around any information that we learn. So the state budget bills, Christina, do you mind doing a quick rundown? I know that you're probably the absolute closest to this, if you don't mind sharing.
No, I don't mind at all. Thanks. So with the state budget bills, there were some good things that happened and there were some things we're watching. So House Budget Bill 2, which is the education DESE budget, so Department of Elementary and Secondary Education, a good thing is that the legislature agreed to put in the maximum amount they need to fund vocational rehab services, which means that we can pull down the federal match, 100% of the money that the federal government would match. And that's a big deal because otherwise we're leaving money on the table. And so those services should be fully funded, assuming the governor doesn't line item veto any of that. A big place where we spent most of our time this session is in House Bill 10 or 2010, and that's where the Department of Mental Health and the Division of Developmental Disabilities is funded and our waivers are funded. So as I mentioned earlier in the budget presentation, the governor had proposed cutting pay rates for personal assistance and medical personal assistance in the self-directed supports program. And the good news is the legislature reversed those cuts. And while there was no increase for those rates, they haven't been cut as of this moment. This may become a point of advocacy for us if we decide to do an action alert to make sure the governor maintains that funding and doesn't go back to his original proposal to cut those. The legislature also reversed proposed cuts to day program rates. So for anyone who goes to a day program, the governor had proposed cutting how much providers can pay the people who work there. However, the legislature reversed that. In the meanwhile, the Department of Mental Health hired a company called Mercer, and they do these rate studies. So they're kind of like actuarial accountant analysts, which sounds very fancy, but they kind of figure out what the actual rate should be. And they do get a lot of data from actual providers about what they pay their employees and how their turnover is and all that good stuff. So that study will come out June 15th, which is obviously after session ends. But the idea is that providers and the governor and the Department of Mental Health will probably sit down at that point to see where the rate study landed and go from there. It doesn't guarantee anything, but it'll be good information for the governor if he decides to line item veto or whatever he decides. After the legislature finished its work, some DD waiver slots were funded. So there are, I want to say 27. There's a chunk of waivers that are there for people who are transitioning out of institutions and nursing homes, but want to go to the community. There's a chunk for children with Medicaid waivers who are transitioning to adult. And there are some potential waivers for people who need, maybe they were on a community waiver, but now they need a comprehensive waiver. So maybe they were living at home with family or friends, and now they need 24/7 support. So those waivers exist, but there aren't many of them. And then the only additional waivers that they funded this year, so for new people entering into services. So if you think about, let's say a high school graduate who's just gotten out of their transition program, and they may not know what's going on politically, and now they're going to apply for a waiver. There are probably no waivers for them. The only additional waivers that were funded were 50 for crisis residential situations. I will say there are questions from multiple advocates, not just us, asking the department what that means exactly. Like, could some of those go to community waivers or not? Because it doesn't specify, but likely it's going to be for people in very kind of dire situations who need a place to live. So we expect that if the governor doesn't change any of this, there will be a significant wait list starting in July or shortly thereafter. In the self-directed support program, I can't remember if we talked collectively about this, but there were two smaller service lines called community specialists and individual goods and services. Those were zeroed out in the governor's proposed budget, and then no one in the legislature added that money back in. It's unfortunate because the people who use those services definitely need them. At the same time, there were very few people using those services. Also, I think not a lot of people knew those services existed, so it's a little frustrating too, because a lot of people didn't know they existed until we heard they were being cut. But there wasn't as much of a public outcry on those, even though we continued to advocate to consider the benefits of restoring that funding. And, you know, again, in the red, it says we will not know for sure what stays, changes, or gets vetoed until Governor Kehoe signs the bills, but this gives us an opportunity to reach out to him and his staff and see if we can advocate. Are there any questions about the budget bills? Okay. Let's move into the non-budget bills and joint resolutions. So these are bills that we weighed in on or were following. And so House Bill 2304 was carried by Representative Phil Olerking. It gave parents and then students who became adults, if they were their own guardian, the ability to consent to their individual education plans or IEPs, meaning any significant changes, the school would have to negotiate with them. Unfortunately, this bill is not going to make it across the finish line unless something very strange happens in the next 24 hours. But a good thing that happened was it was amended to another bill that ultimately failed. But in the process of that, Philip Olerking asked for a roll call vote because House leadership kept saying there were no votes for this bill. And as it turned out, more than 90% of the House of Representatives voted in favor of this bill on that roll call. So now there's evidence that there's broad support for this. So that'll be helpful for next session when advocates take this up again. House Bill 1840, this is exciting. It just passed a few hours ago, and it has another bill that we were working on and following attached to it. So 2 wins for us, yay. So 1840 is the Purple Alert System, and it trains and allows law enforcement to send out alerts, kind of like an Amber Alert, for people with IDD who are missing, and I think it also includes the elderly as well. It says in here that it still has a chance, but it just passed like 2 hours ago. So yay. And then attached to that, if I can jump down to 2408, it has this bill that our policy fellow, Lydia Olmstead, has been working on for support service providers. And these are people who help the blind deaf community access their community, get driven to their jobs or to know what's going on around them, or visual descriptions, whatever they need to access their communities. And that was attached to that bill. So those both just passed. So yay, we have to celebrate the wins too. Unfortunately, House Bill 2183 that I kind of skipped over by Representative Ian Mackey, it was going to ban seclusion in all Missouri schools. It didn't make it across the finish line. It was amended onto another bill, House Bill 2933, but that's not going to make it either. Again, I'm saying this with asking for your grace because something strange could happen in the next 24 hours, but it's highly unlikely. The next 2 things are called House joint resolutions. So unlike a regular bill, these are bills that are dealt with in the House and the Senate, They have to be passed on both sides, but they don't go to the governor. Instead, they go to your ballot, which is like what we were talking about with the income taxes. So two that we were looking into, focused on, spoke up about a little bit. House Joint Resolution 154, this was carried by Representative Darren Chappell. And initially, it would increase Medicaid work requirements above what the Big Beautiful Bill did last summer, or HR 1. If it passed at the ballot, it would be in our Constitution, meaning even if the federal government reversed work requirements at some point in the future, Missouri would still have them. It did pass in the House, but it kind of ended up stalling out in the Senate, and there were a lot of concerns about it. I guess it's one of those things where it's possible something could happen in the next 24 hours, but it's not looking likely. And frankly, it's going to be confusing to voters, because even if it goes to the ballot and it's voted up or down, it doesn't matter, because there's going to be work requirements because of the federal government. So explaining that to people is confusing too, but it looks like it will not be on the ballot, most likely. The other one is the income tax one that I was sharing with you, and it's House Joint Resolutions 173 and 174. This is the phase out of the income tax, and it gives the legislature the power to increase sales taxes in the future to an unknown amount and without stating which goods and services could be taxed. So, on the one hand, you might be thinking, sweet, I don't have to pay income tax. On the other hand, we don't know what the sales tax will look like. It could get pretty intense, which would be hard for people on the lower end of the income spectrum. So those are the highlights. And again, session ends tomorrow, so things may change, but happy to answer questions or take comments.
On 173 and 174, and you may not know the answer to this, what is the possible timeline for the quote unquote future if things were voted in? Because I could see all Missourians thinking, hey, this is sweet, we don't have income tax, and then later have it double or impact things that it's never impacted before. And what would that potential timeline look like?
I don't know. I have to look again.
Yeah,
it's been
that's fine. That's
busy, but I think it would be pretty fast,
Sure.
within a year or two. Yeah.
Yeah.
I will double check though and get back to you all.
No worries. No worries.
What's going to happen to places that you may not know this? What's going to happen to places that were funded by income taxes?
Mr. Chair, would you like me to answer?
Please go ahead. Yep.
Yeah, I think it's complicated because it makes up 60% of the state budget. It doesn't look great unless we increase sales taxes dramatically. And then that would also be challenging for a lot of us, especially given inflation and how hard it already is to pay for things and maintain benefits. So that is something we're looking at. And yeah, our concern for people with disabilities, how they would weather a dramatic sales tax increase when they have to have a certain level of income just to maintain their benefits typically.
With the ballot line, do you know what's on this joint House Resolution 173 and 174? It says it gives the legislator the power to increase sales tax in the future to an unknown amount. Would that language be modified on the ballot? Because that's a little that's very concerning to me.
Yeah, I mean, the ballot language is supposed to reflect an actual summary of the bill. So, I mean, it should say that. And I think people will read that and have questions. But that is definitely a point of advocacy. I do know there are a lot of organizations, not just disability organizations, who are concerned and speaking up and trying to educate the public that it sounds great to not have income taxes theoretically, but taxes do pay for government services. So I think there's there's really some serious education that needs to be done, because most people don't know what taxes do, and I don't mean that in a condescending way. I think just people don't think about it usually.
Right.
Anyone else?
Yeah. The tax that people people who going they say they're up their tax. The tax. Are they raising the tax up?
The sales tax that
Yeah.
they might raise, yeah.
That's gonna be hard for the people who don't got much money to pay for tax, and people who who works for a living, you know, and they have to pay bills. But if they raise the food tax, you know, there's gonna be a lot of people who won't like that because they got a lot of bills to do and everything. They got bills to do, and if they're gonna raise the taxes on the bills, raise taxes on food, raise taxes on everything it is in this area or wherever else in the United States, that they need to stop raising the taxes for people who can't afford to do stuff.
Okay. Anyone else? Any final comments before we move on? Emily, go ahead.
Thanks, Tony. Christina, do you know off the top of your head, like, is it the governor that decides which ballot it goes on, and when will we know?
Secretary of State, and actually, I'm going to follow up on that. I'll let you know, but it would either be August or November. So as soon as we know, we'll put the word out to people. Yeah.
Okay, seeing no additional hands and seeing nothing in the chat. Thank you very much for all those updates, Christina. Next on our agenda will be engaging legislators when they're back home. So that document is actually called How to Engage Legislators When They're Back Home.pdf in the members only area. So if you want to follow along on your own machine, or if someone doesn't mind sharing that on the screen, thank you very much. And so again, as Christina mentioned, and we talked about, all of the legislators leave Jeff City after tomorrow. A couple days that they're back in September, but mostly they'll be in your area beginning now until December. Thank you, Christina, for putting the link to look up your legislators to know who represents you. And speaking of representing you, in November, regardless of what party, all of your representatives will be looking at their next step. And that next step might be a new role that they're seeking through elections. It might be, exiting the area because they've reached their maximum term, also known as a term limit in their role. And so it's a great opportunity here during the downtime to meet all of the candidates, whether they're looking for a new position within the government or they're trying to come in as a brand new legislator, or no matter whether they're red, blue, purple, green polka dot, or whatever affiliation regarding their political affiliation. The bottom line is each of these candidates have the opportunity and may be representing us, and some of them will continue to represent us into their new term. So it's a great chance to go out and shake babies and kiss hands. I mean, kiss babies and shake hands. And so a good opportunity to meet folks and to get topics out in front of them, let them know what's of most concern to you. So the weeks after Election Day, before January, are also a good time to reach out. Let them come into their new role and into the new term with a knowledge about disability, about services, why they're important. Let them know about MODDC. Some of them will have never heard anything about any of those topics. Christina, do you want to comment on that? Because I'm sure you've run into that more than once.
Yeah, thanks for asking. I think there are very few legislators who run on our issues, for better or for worse. It's just they have different specialties or backgrounds. So it's really incumbent upon us, because legislators have term limits in Missouri, to get in there as quickly as possible. My own legislator is Phil Olerking, who carried that IEP bill, and I met him for coffee post him being elected, but prior to him being sworn in. And I told him that I'm a mom, that I care about disability advocacy. He said, "What's an IEP? Tell me more about disability." He didn't know anything. And now he's carrying bills for people with disabilities. So I'm not saying it always works like that, but it can work.
So yeah, thank you for sharing that, because great point that they don't exactly wave a banner with our issues on it and run on those topics. That's not generally at the forefront of what they're running on when they run for their campaign. So Christina just brought up building relationships with the state legislators. Let them know what happened that was good, bad, or otherwise from the previous session. Awareness. So again, Christina, please jump in
Chair,
here. Yeah, go ahead.
May I just clarify one thing? It does
Yeah.
say in the document to reach out to me or Roger if you have questions. Please reach out to me going forward. I just didn't have time to update this document. Thanks, everyone.
Sure. So again, whatever helps or hurts, share those things. Christina talking about coffee. That's a great idea. Libraries are a good location because they're a neutral site. And it's awesome that you can go, get a room at the library. That's a great spot. Let them know what is your purpose for being a member of the MODDC and what you're passionate about, any positions you want to discuss. Going into the Coffees for Change, Christina, can you give everyone an update on that? I know there's been an announcement about the first one. If you could share some of that progress, please.
Yeah, thanks, Mr. Chair. We've been working on Coffees for Change for a while. You've been hearing me and Tony talk about it a bit. And the first one is coming up June 4th in Perryville. Allie is hosting it at 10 a.m. A local business offered their space for free, and the County Developmental Disability Board is covering the food and snacks. And it already we have, last I checked, 6 people signed up, which for Perryville, I am excited about, and I think we'll get more. So these will be rolling out as council members step forward and are interested. And Mr. or Dr. Tony Taylor is next up in Kansas City. So his will be July 10th. And so as we get more, we'll add them to the sign up pages and we'll add them to social media. Right now, those are the only 2 that we have kind of set details, but more to come soon. And if anyone sitting here is thinking, I'd like to do one, and I know there are a few of you we've already discussed this with, but we just haven't confirmed, please reach out, because we want to do them in every corner of the state if possible, to engage people and to help grow our advocacy army, so to speak, so that there are more people educated on disability issues and speaking up for themselves. Yeah. And again, please direct any questions or coffee questions to me.
I have a quick clarifying question, please. Mm-hmm. Social media shows that it's on June 3rd. Is it the 3rd or is it the 4th?
It's June 3rd. Sorry, I need to update that.
Okay, finally on the document, talking about community events, local events. I know some legislators have regularly scheduled town halls or other meetings within their legislative area. So those are usually posted online. So if possible to attend, introduce yourself. Even at that, you could share your contact information, ask for an additional meeting separate that's a one-on-one from that public town hall or community event. There's also, again, for candidates, that's also a good opportunity to meet the candidates for any kind of local events that they might have as well. So does anyone have any final thoughts, comments, questions about this document or other ideas for engagement with your legislators during off session? Scanning. Springfield, Scott Steelman says in the chat, Springfield for coffee.
Let's do it.
Okay. Okay, give everyone a moment here in case anyone needs to get off mute before we move on to the next topic. Okay. With that, we'll move on to the approval of meeting.
Can I just share one more thing? We
Absolutely.
did include on members only a shortened version of a document you saw in January about what you can do to, and so it goes into more details of other things you can do to engage your legislators. So that is also on members only. So feel free to check that out as well.
And that shorter one, I believe, is the local version. I know we had some other versions for, state or national, but this is specifically like within your neighborhood, local. I'm trying to find the document. Here it is. Let me share that. Can everyone see that document?
Mr. Chair, I'm happy to share it. If,
okay.
Yes, because I don't see it.
So emails, action alerts, phone calls, just educating those around you, asking them to join you to vote. Again, hosting a coffee, attending an event, visiting the district office. Okay. Thank you, Christina, for all the information. That's very helpful. Very helpful. Okay. Moving on in our agenda, approval of the March EOC meeting minutes. Can we get a motion for approval? Lisa.
So moved.
Lisa Crandall with the first. Anyone with the second?
A second.
Not with a second? Okay. Okay. And if we could get a roll call, please.
Tony,
Yeah.
Animesh, absent. Heather, absent.
I accept. Thank you.
Jelani,
Approve.
Lisa,
Lisa Crandall, approve.
Rachel,
Rachel abstains, but can I also make a point? Tony said EOC minutes, just making sure they say LLP.
They should say LLP. In the agenda, it said EOC and it shouldn't have. My fault. I read that wrong. Yeah, that's a great point. It should be LPP.
I figured we all knew what we were approving, but just to clarify.
We did. I read it off the agenda, and the agenda said EOC, and I just read along. My fault.
technically it's my fault, but I've corrected it.
It's all great. Thank you.
Scott,
Abstain.
Leandra,
Approve.
Kim is not here. Nadia? Approved. Nadia approves. Steve?
Approve.
Your motion passes.
Thank you very much. Next would be new business. Does anyone have anything to share for new business?
Yeah. They
Okay.
need to build more homeless shelter for people who live down the street. Don't have nothing that lost everything, the house fire, and they're out there on the street, side of the street begging for money and food and stuff like that. I'd like to know they need to build something like that for people who don't have no home to go to and stuff like that.
Okay. Okay. Anyone else? New business? Going once. Going twice. Okay. And future agenda topics. Any ideas? Okay. With that, we are a little early to adjourn, so I would need a motion to do that. Okay, a motion from Nadia. And so thank you everyone for your involvement. Thank you, Christina, for the great information and updates on all things. And if anyone has any agenda topics, feel free to email or phone or skywrite. Let's see. Yeah, it's not too cloudy. You can skywrite. Thanks, guys. Appreciate it.
Bye.
Thank you.